right, good morning. Happy Wednesday. Does anybody have any questions about what we've gone over prior to today? Today is the halfway point, by the way. Okay.
Or last class. I am not fully caught up, almost there.
When I call your name for homework, just say pass, and we'll come back to you next class. Okay? Okay, good. I will ask you about that then. All right. So any questions about the principles that we've covered, about the skills, anything that is pressing before we jump in? Is everybody feeling somewhat okay with this? Okay. All right. So over between last class and today, you guys had one chapter to read. That was chapter 4. And you took the test on page 184 in your book. And hopefully you graded it using the answer key at the back of the book. When I call your name, if I can get either how many you missed or your scores, if you did not get to it, just say pass. Victoria? Thank you. Tempest? How did you, Tempest, do you have 1, 2, and 3 for me?
I have 1, 2, and 3.5. Or 2.5.
Okay, just give me 1 and 2 then, the ones that you've gotten done. It'll be on page 181 and 182. No, just tell me how many you missed.
19 out of 20, 19 out of 21.
Okay, so you missed 1. Got it. And on the front of your yellow book is a number. Can you give me that number?
Y8.
Thank you. Okay, Jayland? Very good. Serena? Brigitte? Monica?
I got 3 wrong. I do have a quick question.
Yes.
Why you mentioned you don't really like that chapter? I actually liked it.
Okay.
Because I felt like if those are the issues, the main issues of a lot of the patients.
It's not the content that I don't like. It's the presentation. Because it tends to be overwhelming for students. It's a lot of information in a very, very condensed format. And students are often left wondering, what do I need to know for the test? What is going to be on the test? Do I need to know that the urinary system is made up of the kidneys and the ureter and the urethra and the bladder? What do I need to know? So it tends to be, it's not that I don't like the content. The content is important. It's I don't like the format that the content is presented in, which is why I made that handout, the pink sheet. That's what I call it, the pink sheet, because that just kind of distills all of that information into one double-sided sheet for you.
I actually didn't remember, but I liked the chapter and I quickly did the assignment 3.
Good. Okay. All right. Kaya, I'm sorry. Okay. All right. And Arjola?
I only missed 2.
Okay. Do you have 1, 2, and 3 for me?
2.
Chapter 1?
Oh yeah. Like how many mistakes I made?
Yep.
None.
Chapter 2?
None.
Okay. And chapter 3?
2.
Thank you. Okay. Ito? Bobby?
90.
Thank you. Jayothi? How did you do on your on your test on this?
I don't understand why. I know everything is wrong because I don't know.
Okay. Okay.
So you tell me like I fill up everything.
Okay. So you did them?
Yes, ma'am.
You did them and you didn't miss anything?
No. I am everything learned either in class and then home, but I am everything is in home. I learn up,
Okay.
but I don't know what the test. This is a test in home.
Yes, that's a test for home.
Okay.
It's in that book. So page 184, page.
184.
So you're going to do
Oh,
this,
fill up.
do this, do this, and do this.
Okay.
And then over the weekend,
Monday, everything.
then you have this and this too.
Okay, ma'am.
Okay.
Thank
Okay.
you, ma'am.
You're
Thank
welcome.
you so much.
You're welcome. Okay. Deja. Thank you. Okay. So those of you who missed some questions, do you know why you missed what you missed? Do you know why the right answer is the right answer? Do you know where you went wrong?
So I did feel that this chapter was overwhelming.
Okay.
And so do you think like that, because this is your book, you made these tests. So do you think that the tests are what we really need to know over the chapters, or that paper that you made?
So the pink paper is really what you're going to need to know.
Okay.
Yeah, just kind of go over that. And one side of it, so this side of it, of the pink paper, I know I got to move, sorry. Okay. Can you see me now? I know you keep. All right. So this side of the paper goes over all the body systems. It shows you what they're made up of, but that's not really important for CNAs, right? You don't need to know the brain is part of the nervous system. Those of you who are going to go on for advanced degrees like nursing, anything, and you will need to know that, but you're going to have a whole year of anatomy and physiology. You'll learn all of that. That's not what I want you to focus on. This column right here is critical for you to know. Anything in this column will show up on the state exam. And the reason for that is very important. CNAs report abnormal, right? We report observations. If you don't know what normal is, then you have no idea what to report. And you'll end up doing one of two things. You'll either report everything, even normal stuff, because you can't differentiate between the two, or you'll report nothing because you just assume the nurse is going to figure it out and you don't know what abnormal is. So as a CNA, we need to know that hearing decreases as we age. That doesn't mean we're going to shout at our patients. Shouting is actually the worst thing you can do when you're working with somebody who has a hearing deficiency, especially age-related, because when you shout, your tone goes up. And higher pitches, higher tones are actually what is lost first in hearing. So the better thing to do, face them, good lighting, so that they can read your facial expression and your lips. Slow down, because we tend to go really fast. Slow your speech rate down, lower your pitch. So when I am talking to somebody who has a hearing deficiency, I don't yell at them. A lot of people do. They get really close to the ear and they yell and they can't hear you. Instead, face them directly, let them see your face, good lighting. I lower my voice like this. I talk a little bit slower and I make sure I enunciate clearly so they can follow. Do you guys see the difference there? That's how we work with patients who have a hearing deficiency. But you need to know that that's normal, and we need to know how to accommodate that so that we can effectively communicate with our patients. Does that make sense? Okay. So this column you need to know. Now on the back are ways that we can intervene. You didn't get one of these? Jake, can you get pink paper, please? And anytime you're missing any review sheets, they're always right there by the door. Feel free to grab what you need. Okay. So if you miss a class or whatever and you realize you need one of these, just grab it off of that. That's for you guys. All right. So this is how we're going to accommodate those changes. So this tells us what those changes are. This side tells us how to accommodate those changes. Okay. So you do need to know this, this handout. This will help you. That's a great segue into the practice test. Okay. So I have been working on this very diligently. It is not done yet. Do you see how big this is? It's not done. There's a lot here. Okay. There is a lot here. It looks very overwhelming. It's not. Jake went through this whole thing in what, an hour and a half?
About that.
An hour and a half. Now, Jake is not a CNA. He really doesn't listen to me when I'm sitting here. He really doesn't, because this isn't his wheelhouse. He doesn't want to be in healthcare. He runs the tech. So he's over there doing other things. He absorbs a little bit about what I'm saying, but it's not his thing, right? But he went through this. And he got most of them right. Now, the reason that he got most of it right is because it's not a practice test. Now, I'm calling it one because that's what you guys are, that's the terminology you're used to. It's not a practice test. It is a guided learning opportunity. So I have created 5 categories of questions. Every question you take on the state exam falls into one of these 5 categories. So if you know there's 5 categories and you know every question is in one of those categories, and I tell you exactly what to answer for that category, you will get 100%. So if the question says you're assigned to perform this task, what are you going to do? Do that task, right? That's follow the care plan. You guys have got that down. So if you're looking at a question and you see as assigned, it's the right answer. Make sense? Good. Yeah, easy. So I did that for every category. Act for safety. If you're reading a question and there's anything in there that makes you think that it's unsafe, you have to act. Look for an answer that has an action. Make sense? Okay. So if you're feeding somebody and they start to cough, that's an emergency. We need an action. So in this case, our action is to stop. We don't go get the nurse because you're leaving a patient in distress alone. So that question will have notify the nurse as the answer and answer. It's not the right answer because you can't leave a patient in distress. We have to act for safety. Make sense? Okay, C is for communication and reporting. So this is going to cover HIPAA, which was in your book. It's going to cover how to communicate with patients respectfully. We go over that quite a bit in class. It's going to cover the difference between subjective and objective communication, again, from your textbook. It's going to cover things like medical terminology and medical abbreviations, which we're going to go over in a little later. So communication and reporting is going to cover all things talking. Whether you're talking to patients, whether you're talking to staff members, whether you're talking to family members, it's going to cover talking. How to do it effectively. Make sense? So if we have a question like a resident's roommate asks how she's doing today, what is an appropriate response? A, tell her it's none of your business. B, tell her that that's confidential information that you're not permitted to share. C, go get another more experienced CNA to answer the question. Or D, consult the patient's chart for accurate information. Right? So you would look at the category to figure out the right answer. Does that make sense? Now, T is probably the hardest one, and that's the one that you guys think is the test. T is theory and concepts, all the stuff you're reading. All the stuff you're reading. If you read it in the homework, That's the T. Okay. And T is all about understanding your role, what you do, how to do it. That's the part that I'm still working on. That's why this isn't done yet. Because just like I did for F and A and C, I need one sentence that's going to give you the answer for everything in that category. And I'm working on it. I'm working on it. Not quite there yet. Then we have S. So this spells out FACTS. These are the CNA facts. Okay, S is skills and performance. That's all the stuff we learn how to do in here. So how to. This is going to be your sequencing, your prioritization, your important steps. When do we use a privacy blanket? When do we put on our gloves? Those types of things. So understand your principles. Always refer back to your principles, everything on that back wall when you're answering skills-based questions. So if I can get that for T, if I can distill that entire book into one sentence, you will have a blueprint where you remember 5 things for the state exam. And you're able to get 100%. Now, I've done it for 4 of them. I just have to have a little more time to work on that T. Okay? And then I'll be able to release this to you. Okay? So that's how it's going to help you with the written test. Everything I do is designed to simplify your practice, not complicate it. Good? Good. So do you think that this is something that will help you? Okay, the way that I structured it, because it's guided, like I said, it's not a practice test, it's guided. I explained the category, what F is, why we have to follow the care plan. And that's just one page, right? One page of what is F. And then I give you 10 F questions. And I bold the important words, like as assigned. So you learn those trigger words. We also talk a little bit about elimination words, things like never and always and force and make and restrict. Those are never the right answers, guys. Those are elimination words. And then once I do that for all 5 things, so there's 50 questions right there. 50 questions right there. Then I give you a 30-question mock exam where I show you, okay, this is a F question. These are the important words. How are you going to answer it? And you choose the answer. Then we go into a practice test where I give you the category, but you got to figure everything else out. Then we go into a total practice, 60-question practice test where I give you nothing. And you've got to apply what you learned to those questions. And at the end of every question is a little line for you to put the letter of the category so you can learn how to identify those categories, apply the principle, eliminate the wrong answers, and then choose the best one from what's left. If you go through all of this, you should be able to take that written test and score 100 on it, even if you don't really understand the content.
That's amazing. I know it doesn't matter, but I'm a real estate broker, and that test is like, and I was 55 when I took it 3 years ago. So basically, essentially what you're doing is you're giving us a free cram course.
Correct.
That's the way to pass real estate is you take all that information, you go to the cram course, which is focusing just what's on the exam. I'm excited that you're doing this.
Yeah,
I it to us for free because you don't get it for free in real estate. You got to go. You pay another $100-something,
right,
sit for a whole weekend and do the whole cram course.
Yeah, I actually was a real estate agent a couple years ago as well. Yeah. I sold my my last house. I didn't want to pay an agent, so I became one.
How long did you actually do nursing as a nurse?
30. Hold on, I got to think of how old I am. Hold on a minute.
I'm kind of wondering how.
36 years.
Wow.
Yeah. Yeah. So I've had a lot of, he's going to laugh at me. I am a serial learner. I am not happy doing the same thing over and over. I have to create problems for myself to solve. That's, yeah, that's, oh, thank you. That's just who I am. If you put me, like, I am not a med-surg nurse. I did it for a year and I wanted to bang my head against a wall. It's just not for me. I can't do the same thing every day the same way. I just can't do that. So I was ER, I was ICU, I was high energy, high acuity, high problem solving. That's who I was. And then I went from there into hospice because it's still problem solving, but it's a different type of problem solving. And I really wanted to be able to support the families that I couldn't do in an ICU setting because we just had too much to do and not enough time. So I moved to hospice so I could support the families. In the middle of all of that, because I've always held 2 jobs, always have held 2 jobs. So I would do hospice. And then I also worked at our local mental health treatment center for about 5 years because I was very interested in psych. And I've usually done home health here and there, you know, picked up some home health. This is particularly helpful when your son has a brand new cell phone and is 12 years old and has no idea what roaming charges were, which you guys don't even know about. But, you know, you have a $600 cell phone bill back in the early 2000s, tended to hurt the budget. So I always had a second job in my back pocket that I could always pick up and say, hey, I need a couple of visits this week. And that is what kind of helped pull me through. So that's the one thing I love about medicine, about nursing, is that there's always opportunity. Always. Yeah. You should never be in a position where you cannot pay your bills because there are opportunities. It's how much do you want to hustle? That's the question. How much do you want to hustle? But the opportunities are there. Now, see, the opportunities aren't always there in other industries. If you're going to work in a customer service big box store, you're relying on them for scheduling. You know, you can't always pick up extra shifts if you need to. So that's what I liked about nursing. It was that flexibility was very important to me. So yes, I have been a nurse for a very long time. And yeah, when we sold our last house, I was the house before I'd had to pay a huge amount of commission. And I did all the work. I was the one that advertised it. I was the one that told people about it. I did all the work and I still had to pay this huge commission. And that just didn't seem quite right to me. Now, I'm a pretty smart individual. I can figure out contracts. Documentation is a legal form. I teach documentation, not a problem. So I went and took a real estate course, passed the test on the first try with 100%, and sold my house, saved myself some money.
I had to do it, and I never sold houses. I strictly did property management, but I
Yeah.
had to do what salespeople. So 10% of what I was learning
Actually applied, yeah.
What I was.
Yeah.
So yeah, it's a very hard test.
Yep. So yeah, I'm very high energy, but that's what leads me to things like this. Now, the reason that I made this is actually not for you guys. This I made because of a problem. I had a student that came through, Jake, when was he here? November? You know who I'm talking about.
Oh, around that.
So sometime late last year, I don't remember exactly when, we had an individual who had a language barrier, but also had a comprehension problem, was really, really struggling with understanding the reading and the concepts and just not getting it. And you could tell he just wasn't getting it. And he would ask questions in class, even though I explained it, I would explain it again in a slightly different way to try to get him to understand the concept. And he was really kind of struggling. So we, explained the online course for repetition, the live streams, just keep going over it and hopefully it will click. And I worked with him as much as I could. Well, he went and took the written test and he failed. And he sent me the printout and everything. And I worked with him extensively on how to understand what they're asking you. This isn't about recall. The written test is not about recall. Everybody thinks it is because that's what you have experience with. The written test is not recall, it's application. The written test is going to ask you, what are you going to do when? If you noticed, all the questions that I present to you are along the lines of, what are you going to do when? That's how the state test is structured. So we have to know how to answer application questions. And his second attempt was successful. We did get him there, ultimately. But I started thinking, I can't do this, spend this kind of time with students. I've got to have something that I can refer them to say, okay, if you're struggling, this is what's going to help. This is me sitting there with you, going through each question word by word to explain to you what the question is asking. And that's where this was born. So this has been percolating since late last year. And I'm finally at a point now that it's almost done. I mean, almost done. I'm so excited. Yeah, and unfortunately, it's the program that we use. Just the resolution just isn't great on it. Yeah, and the camera itself is actually a high resolution camera. It's just that because we're live streaming, they have to compress the stream. Otherwise, the platforms won't accept it. It's too high bandwidth. So yeah, there is a benefit to coming to class. Or to having the book in front of you, because I've got, and if you notice, the page number is always really big. So if you're attending from home, you don't need to rely on this. You should be turning to the page in your book, just like you do here. So yeah, it is, the pages are a little bit fuzzy. The graphics tend to be a little bit better though.
It looked a little bit better the other day, but like today, just whenever the screen on everything just was very bright. So I was just wondering if it was going to mess anything up for you.
Yeah, no, it's so what you see on this screen is what they see. It's not this, it's the whole thing. Yeah, I just and I've kind of played around with having the camera tighter on me so that you don't see all of that, but I refer back to it so much. I'll point to the screen and then I'm pointing off screen to the people that are watching. So I leave it that way. I know you want to pay attention. This is what's there. All right. So the pink sheet we've already talked about. I'm going to skip over that. Quick review. Because I went off topic here. Quick review. You will have, this is class 4. You will have a review on class 5 and 6 next week. Class 7 is a very, very abbreviated review. However, before you go take your test, you need a review. So I want you to tuck in the back of your head, class 7 is going to be your best opportunity for a comprehensive review before the test. And I do it in like 20 minutes. Okay, good. So class 7 is where you're going to find the best review. So, and I bring that up because if you're watching the review for everyone, I mean, I go on for a little bit here and it's not a brief review, even though I say it's going to be. All right, how do we know what to do with each patient? The care plan. We follow the care plan, the whole care plan in. Nothing but the care plan. While we're following that care plan, we should be making. And who needs to know those? The nurse. All right. Every skill starts with an opening. Every opening starts with a knock. Can I skip that for the test?
No.
No, absolutely not. Make sure that you're doing the entire skill. Remember, the opening and closing makes up to half of your checkpoints for every skill. When you're practicing, don't cut corners here. Once you've knocked, you're going to greet who? Yeah, the resident, the patient. Greet the person in the bed. How are you going to identify them? by name. Yep. And for the test, everybody is Mr. or Mrs. Jones. You're going to introduce who?
Yourself.
Yep, yourself by name and title. They need to know not just who you are, but what role you're about to play. And then what are we going to tell them? Yeah, what we're there to do. I'm here to whatever. Put it in your own words, read it out the care plan. Nobody cares. Just make sure they understand what it is that you're about to do. And then what do we need to get from them? Consent, very important. Once we've done all of that, we're going to close the privacy curtain. Is that curtain clean? So what do you want to do about it? Wash your hands. After you've washed your hands, then you can go get your supplies.
So for the name, it's the first name or the last
Mrs. or Mr. Jones for the test.
name? Right.
And in a clinical setting, oh, you're about to see, I'm gonna get derailed here when you ask me that, because I don't know how to give you a straight answer without expanding on it. I just can't do it. Here's the deal. Okay. You can use first names. We're a very informal society. You can use first names. I don't, because I feel that there needs to be a professional separation, right? I am there to take care of their most intimate personal tasks. There needs to be, so that lines don't get blurred here, there needs to be a professional separation there. So I tend to use last names. Mr. Hopkins, Mrs. Adams. I tend to use those last names when I'm working with patients. Now, because we are in an informal society, your patients are probably going to say, oh, just call me Adele. And that's fine. I'll honor that, but I am going to put a Mr. or Miss in front of it because I'm a Southern girl. And that's how you show respect to your elders if you're on a first name basis. So Miss Ida, Mr. Cliff, right? So you're not judged on this in a clinical setting. You can handle this however you want to. But for me, I don't want any lines blurred. Because when you start blurring lines, things can get messy really quickly. And I'm going to give you an example of what I mean. And this is an uncomfortable example, okay? But you guys are young and you're going to be taking care of older men. Older men tend to like younger women. Now, you're going to be providing very personal care on these older men. And if you're calling them honey, sweetie, dear, or their first name without any qualifier, their minds may attribute an intent there that's not there. Does that make sense? Now, we haven't done anything to lead them on. We haven't done anything to make them feel like we have any sort of interest, but we don't have to for their minds to go there. If you keep this professional, no honey, sweetie, baby, love. We don't flirt. We don't become overly familiar. And you use those honorifics, Mr. Cliff. It creates this separation. And as long as you're remaining professional and acting professional and presenting yourself professionally and you have that separation, you actually cut down on this inappropriate behavior. Does that make sense? It's all in your approach. So the answer I just gave you has nothing to do with the test. Nothing to do with the test. For the test, Mr. and Mrs. Jones, just keep it simple. But you need to know what to do in a clinical setting because this is an uncomfortable situation and it happens every day. Yes, it happens every day in every setting. And we have to know how to deal with it. So the way I deal with it is I remain professional. I don't yell at them. There's no need. They've misconstrued the situation. There's no need to get mean. But I am very matter of fact. That's not appropriate. You pull out your mom voice. Every one of you has one, whether you're a mom or not. You know the voice I'm talking about. That will not be tolerated. If you would like me to provide assistance, I'm happy to do so in a professional capacity, but your behavior will not be tolerated. There's nothing worse for a man than to be reprimanded by a younger woman. And as long as you remain professional, it'll throw ice water on whatever they got going on. Okay? But there's no need to get mean about it. Just very matter of fact. Guys, you have to understand that most of these people that are in a facility are bored. There's nothing to do. It's the same thing every day. They're bored. They're looking for entertainment. Same reason that you pick up your phone and pull up The Bachelorette, right? Or whatever the show is that everybody watches now, right? That's all about drama. They're looking for drama. They're looking for entertainment. And if they can make your face go red and you get all flustered and, oh my gosh, you know, and get worked up, that's entertainment. So don't give it to them. That's not appropriate. Period. It shuts them down. Then they go pick on somebody else. But if your staff is well trained, nobody in the staff is going to react. I don't ever go off topic.
So one of my best friends, she works at the Brooksville Nursing Center, and for the elderly, and she said that one time she was walking into work, and she saw two very known residents sitting outside, one female, one male. Female giving oral pleasure on an outside bench, two male, openly in front of everybody.
Not appropriate.
She said, I didn't even know what to do in that situation.
Report that to the nurse.
Aren't you the one who said you want to work in memory care?
Yeah.
Get used to that, honey.
Well, they're behind closed doors, so it's not on the bench in the open. Yeah. So let's talk about this uncomfortable topic. Okay. We are sexual creatures. We assume, especially when you're young, because, you know, old people's sex is just weird or gross. We assume that sexual drive is going to go away at some point, probably like when you're 30, right? You young people think it's going to go away at 30, but it doesn't. We are sexual creatures.
We're actually made to be.
Absolutely. That doesn't end. Now, your ability to partake in that may, but the drive doesn't. Does that make sense? Now, just like everything else, some people have bigger appetites, some people have smaller appetites. Some people like sweet, some people don't, right? There's natural variations of everything, including sexual activity. Your job is not to shame them, make them feel bad, make a big deal out of it. Right. Our job is to ensure that no one is being taken advantage of, and that any activity is not inappropriate, like in an inappropriate place. If you have a concern, who do you report it to? The nurse. Absolutely. It's not your job to take care of the situation. It is your job to report it to the nurse, because the nurse has to kind of make sure that nobody is being taken advantage of, right? So if we have one patient that is there for rehab and he is a fully cognizant, aware, able to make decisions patient, and we have one dementia patient who does not have the faculty to consent, that is not a consenting relationship. That's not your judgment to make. That's the nurse's. So in that situation, now I still can't have people doing that in public out on the bench. So in that situation, it's Miss Betty, not appropriate out here. Come inside with me, please. Okay, we're going to stop the behavior and let the nurse sort it out. But we're not going to allow them to continue that in a public place, because just remember I said everybody has appetites. Well, one of the appetites out there is, you know, public exhibition. right? So some people will do it for attention, for the drama of it. We don't want to get into that. Again, no reaction is a reaction. Right? There's very little in life that surprises me.
I brought that up just because I wanted to know what I would do in a situation.
Yeah,
like that.
that's not appropriate. Not out here. I mean, what would you do if you walked out to the bus stop right here?
Yeah.
And saw that? Yeah, and that's, yeah. Yeah, but the police aren't going to do anything but tell them to stop, right? And just as simple, that's not appropriate. It goes a long way. That is kind of my go-to statement. That's not appropriate. Stop. Nobody wants to see that. You know, that's just not appropriate. And if it were happening out at the bus stop out there, I would say the same thing. That's not appropriate. Knock it off. Right? And that startles people because they want that reaction. Oh my God, what are you doing? No, it's not appropriate. Knock it off. What are you, 4? You can't control your impulses? Really? Knock it off. So the more matter of fact you get, the less emotion you give them, the less they're likely to pull that kind of stuff around you because you're not giving them the reaction they're looking for. Okay. So yeah, I would not tolerate that. Absolutely not. But go let the nurse know. Yeah. As a nurse, I'm going to have a few things to say about that.
I would say the same thing goes for combative.
Oh, absolutely. Absolutely. Being matter of fact and professional is good. But if you start screaming at them, that's just going to escalate the situation. Now, especially with your nonverbal combative patients, let's talk about nonverbal for a second. If you are nonverbal because of dementia, because of a stroke, because of disease process, if you are nonverbal, if you can't make your needs known, the only way you have to get any information across is through action, right? So here's an example that I encountered in nursing. We had a patient who was nonverbal. He had had a stroke, and the CNA was putting shoes on, and he was not a very pleasant person. He did not want to be in the facility. He was mad because his health had changed. His whole life had changed. He was grumpy and miserable and understandable. This wasn't what he had planned for his retirement, right? He expected to be on a beach in Cancun with margaritas and senoritas, right? This wasn't what he had planned. So he's pretty angry with the world, and I get it. I do. And he's nonverbal, so he can't complain about it. That's even worse, right? You're sitting with your thoughts all the time and have no way to express them. How frustrating would that be? So he's kind of a grump. We know that. Well, the CNA went to put his shoes on one day, and he started kicking her. And I mean, he kicked her. He got a good kick in. She threw the shoe at him and came out, and she's just complaining and how mean he's getting. And I said, okay, hold up. Valid point, but is it possible that he's trying to tell us something? So I went and got the shoe and put my hand in the shoe, and inside the shoe were those stickers, you know, the pointy things. She's trying to shove the shoe on his foot, and those stick tights, those stickers are pushing into his skin, and he can't explain to you what's happening. He is nonverbal. So what is his only option? That's right. So he wasn't kicking because he was being mean. He was kicking because he was trying to give us information. Now, our minds always internalize everything. He is being mean to me, right? We tend to turn everything around so we are in the spotlight. We all have main character syndrome. Anything that happens to you, you automatically assume that it was done to you, right? We all tend to have this persecution complex. But when we're working with patients, we have to take a step back, tone that down a little bit. I'm not saying it's not valid. It may be, but we've got to tone that down a little bit and try to see if maybe, just maybe, this is somebody else having a bad day, or this is somebody who is trying to get us to understand something, right? Or it's a signal of something that they can't verbally express. Does that make sense? Good. I'm actually writing a nonfiction book. I know. I'm actually writing a nonfiction book on this, on perceptions and how they shape our perspective. And this is very, very relevant to our discussion. Okay. So yeah, coming to a bookstore near you. So yeah. Yeah. I actually have a fiction book that is, I'm trying to get to. I've got about half of it written. I just can't get back to it because there just are not enough hours in the day. I got to get this project done first. So told you I don't sleep. Yeah, I don't sleep anymore. I love what I do. I'm very fortunate. I love what I do. Love what I do. Yes.
Sorry, ma'am. Coffee machine.
Oh, please. Yeah, help yourself. Yep. Jacob, can you help her with coffee, please? Jacob. Okay, so totally off topic, but after we've washed our hands, we're going to gather our supplies. Remember our, don't come to today for the review. Remember that our cardinal rule here is that we have to have clean hands to touch the patient. Any questions on this? All right, when we're talking about supplies, one of the first supplies we have to consider are gloves. Now, gloves aren't worn for everything, because when you wear gloves for everything, you tend to touch things without thinking about it, and that's going to put our patient at risk. But we are going to wear gloves if we're going to touch body fluids, personal skin, and personal skin is anything covered by a bathing suit, by the way. Okay. If you're going to touch anything that's normally covered by a bathing suit, it's considered personal skin. And non-intact skin. So wounds, rashes, sores, incisions, natural body openings. If you're going to be anywhere near any of those things, or if you might be anywhere near any of those things, then gloves are appropriate. If you decide to wear gloves, the first thing they should touch is the patient. Very good. And then if you've worn them and you've touched the patient, be careful about what you're touching in the environment so we don't transfer pathogens around. And then once we're done with the gloves, we have to remove them appropriately. So without cross-contamination. Dirty glove can touch dirty glove that cannot touch skin. Please remember that. So we'll pinch up, pull off, go under, pull off. If we're going to use supplies, we have to have a clean place to put those supplies. And that's where the barrier comes in. So the barrier, the barrier gives us a clean place for our clean supplies. And remember, you can only touch your supplies with clean hands. So the order of this matters. We do our opening, we wash our hands, then we get our supplies. The order here matters. When we're getting supplies, don't let them touch your uniform. It's not clean. And we're going to get that barrier first, put it on the table, and then go get the rest of our supplies and put those on the barrier. That just keeps us from holding those supplies up against our uniform when we're trying to spread that barrier out. And one of the supplies you may have to get is a privacy blanket. And we use those to keep our patients warm and protect their privacy. That's used for two things. Don't make the mistake of assuming I've got a privacy curtain. That's good enough. That doesn't do anything for temperature. It also doesn't block them from the stranger in there with them, you. So it's used for more than just privacy. We're going to use it anytime our patient is uncovered or undressed. We're going to put it on top of the sheet, no snapping or shaking, and pull it down under, pull the sheet down under so the patient is always covered with something. And then when we remove this, actually counts. You don't, as long as you haven't touched anything ooey gooey, you can remove the privacy blanket whenever. But if you've got soiled gloves on, especially, if you've got remember we wear gloves if we're going to touch body fluids, right? So that means that our gloves have body fluids. If you're wearing gloves, you don't want to touch that sheet and bring it up right next to their face with those soiled gloves. So you want to wait until after you take your gloves off to pull the sheet back up and remove the privacy blanket. Does everybody understand that? All right. So one of the other supplies we may need are linens. Now, if we're going to use linens, there's some rules here, and most of them we already know. Linens can't touch your uniform. We know that. You have to have clean hands to get your linens. We know that too. Don't snap or shake the linens. Yep, we've got that one down. We also learned last class that clean rolls toward me and dirty rolls away. And this is how we change anything underneath the patient. This helps prevent gross contamination, right? Stuff from the top part of one sheet touching the new sheet. But it also just provides a really easy way to manage all of this fabric while we're trying to put it under the patient so we don't accidentally injure them. Let me tell you a story about this. And it really has to do with gloves and jewelry as well. When I was a brand new nurse, I mean, baby nurse, like probably less than 3 months, brand new nurse. I was working in a rehab center. And one of the patients I was taking care of was a morbidly obese individual, probably, I have no idea how big she was, but probably somewhere in the neighborhood of 500 pounds. And we had chucks under her, you know, the absorbent pads under her. And I didn't know this whole clean rolls toward me, dirty rolls away. I didn't know all that. So I'm trying to push this chucks underneath the patient. Now, I was newly married at the time, and I had an engagement ring on, and I had gloves on. And as I'm pushing this underneath the patient was kind of up on her side, but 500 pounds, she's not going to be all the way on her side. And as I'm pushing this under the patient, she rolls back onto my arms. Now, my arms are trapped under her. And she's 500 pounds laying on top of my arms. And I've got to try to pull them out. I mean, there's no way around this. So yeah, what did my engagement ring do? It didn't just scratch her, it gouged her. I mean, it was a deep gouge.
Must have been a pretty diamond.
It really wasn't. That was the last marriage. Yeah, the starter kit. So unfortunately, now I've got human tissue in my ring. And guys, that doesn't come out. You can wash it, but this patient is now a permanent part of my marriage. But even worse is the fact that she now has a huge wound on her backside that is going to get limited healing ability because she doesn't move. That's right. And we need movement for our immune system. And sure enough, it got infected. Yeah. Yeah. So this was a big lesson for me. And understand that I've taken this lesson with me throughout my entire career. Now, as you know, I don't wear ring. I mean, I wear this. This is a flat ring, and I'm not in a clinical setting. This is a smart ring, kind of tracks my, my body stuff. But if I were working with patients, this would stay home. If I'm working with patients, I do not wear jewelry. And that's because the risk to the patient, but also to myself, is too high, because all of that jewelry is not going to be washed effectively unless you're putting it in an ultrasound cleaner every night. You are taking pathogens in and out of environments, and I don't want those pathogens in my home. Most settings are not, yeah, they don't enforce it. So you'll see medical people with bracelets and rings on every finger and all kinds of stuff because it's not really enforced.
But normally it's supposed to only be a wedding band.
Right, a flat band. But people, they push back on that. Well, this is my expression. Again, we all have main character syndrome, don't we? Right? I don't want to give up my jewelry, right? Not really thinking about the ramifications of it, or in some cases, not really caring.
Some that is like nail
Acrylic nails, same thing. Yeah, right. I don't have acrylic nails. I mean, I do have them occasionally for special occasions. But again, I try not to work with them because of that. Just, and if I do have them, I keep them very short, what they call sport length. Now, somewhat recently, I went into a clinical setting to see somebody, and the nurse that was in the setting had long acrylic nails, and they were tapered to a very sharp point. Like vampire nails, I think they're called, is what they're called right now. And to me, if I were the nursing supervisor, that's not appropriate. I would have said something about that. So, I mean, it just really depends on where is your focus. Is your focus on right? Well, let's go a step further. Is your focus on providing the best possible care for the patient, or is your focus on your own emotional needs? And you kind of have to figure out, it's a spectrum, guys. You're not going to be all the way on one side or all the way on the other. It's a spectrum. Everybody's going to land a little bit differently on that spectrum. There's that perspective thing, right? You're going to land somewhere on that spectrum. You have to figure out where you're going to land that's true to you. But you can't make that decision unless you understand the entire spectrum so you can figure out where you land on it. You'll make a different decision than you will. And that's okay as long as you both understand the entire spectrum. But if all you see is your own perspective, then any other perspective in your mind is wrong. Does that make sense? Okay. So this is the same issue. So when we're talking about things like wearing jewelry, especially stone jewelry, if we're talking about things like when to put gloves on, even things like clean rolls toward me, dirty rolls away. Had I had that clean rolls toward me and put that under the patient, my hands wouldn't have been pushing all of that material quite so hard, which caused the patient to come back. So again, how much of what we learn in class are we actually going to perform in a clinical setting? Because when you get out there and you start working, you are going to hear these terms like, yeah, that's the way you do it for the test. It's not how we do it in a clinical setting. Or, yeah, nobody has time for that's my favorite. No, ain't nobody got time for that. Okay. Yeah, I don't like that mentality, right? Because when you start cutting corners, it's the patient that's ultimately going to suffer. This is why I explained to you the why behind every step. This class would be so much shorter, so much easier if I just gave you rules and didn't explain why. If I just told you what to do and expected you to remember it. But then when you get out there and you start working, those rules have no meaning to you. They were just rules. You'll forget them. You'll disregard them. You'll determine a better way to do the skill that meets your needs, not the patient's. That's why I have to tell you the why, because I am truly hoping that I get through to enough of you that you will continue to do what I've taught you to do when it really counts. It does. It does. Yeah. I was the kid. Oh, I was an only child. Can you tell? I'm an only child. I drove my mom nuts. I really did. Because at 2, why? And I never outgrew it. Why? Why? I drove her nuts. And, I got the standard mom answer sometimes because I said so. Because I'm the boss, right? Every once in a while I got that answer. But my mom, she tried to play along as much as she could. And she gave me the why, or she gave me the resources to find out why. And I think that really helped form a lot of who I am. So when your kids, how many of you guys have young kids? Anybody have young kids? Yeah. When your young kids ask you why, answer them. Answer them as much as you are able. Because if you just give them the old, well, because I said so, or don't worry about that right now, or something like that, you will teach them to quit thinking. Awesome. Awesome. Yeah, that why is super important. Super important. All right. So clean rolls toward me, dirty rolls away. Don't let anything touch the floor. What's the only thing that can touch the floor? Feet. Shoes, actually. I should amend that. Shoes. Shoes. We're going to learn about that in a little bit. Shoes are what touches the floor. And then anything we take and don't use, we have to discard. All right. Okay. We also learned that the patient always has to be in where in the bed? In the middle of the bed, because we don't always have side rails to keep them safe. You cannot rely on side rails for safety. So if we don't have side rails in all settings, we have to make sure they're in the middle of the bed. The way we do that is to scoot them toward us and then roll them away. We call this scoot and roll. You always roll them away from you. So you remain behind, the patient's behind. Yes. Patients have to be in the safe zone in the middle of the bed. All right. We also learned washing rules. So basins are no soap zones. We don't add soap to the water in the basin. That keeps it clean for rinsing. Good. We use a paper towel to turn that faucet on. Faucet is not clean. Your hands are. So use a paper towel. We're going to check the water temperature. It should feel warm, not hot, not cold, just warm. And who else checks it? The patient. The patient, not the outside, the inside. Yeah, the patient has to check the water, and that's a graded checkpoint. But it's not just the patient that's going to check it, by the way. The evaluator will put their hand in that water. So this isn't a pretend skill. If you're going to use water, you're really using water. You are really going to, it's not a simulation. You go to the sink, you get water, you check it. You ask them to check it, and the evaluator will also check it, because that person that's playing your patient is another testing student, and they'll probably lie for you. That evaluator will put their hand in that water to check it. Do not try to get somebody to do foot care in cold water. That's uncomfortable, but it also can affect the heart rate. Isn't that crazy? Can affect the heart rate. All right. We're going to, this next one, use the leaves method for wet body openings. We're going to talk about next week. Okay. Whatever we wash, we rinse. Whatever we rinse, we dry. Keep that mnemonic in mind. You will need it when you're doing skills. Whatever I wash, I rinse. Whatever I rinse, I dry. I know it's simple, but it works. Simple is always elegant. Change the water if it gets cold or soapy. That makes sense. And don't get your surface wet. So if we're working on a table, barrier works fine. If you're working on the bed, a towel or a barrier will do the job. And then if you use lotion, warm it up first, put it on, wipe off the excess so it doesn't stay on the surface of the skin, creating a slipping hazard. Now, if we had a basin that held water, we got to learn how to clean that basin. This is very simple for the test. Rinse it, dry it, store it. Nobody cares. But where you dump it does count. If you're dumping water, it goes in the sink. If you're dumping waste products, they go in the toilet. Go ahead.
Facebook page that I'm on, they're always asking, did you pass? This. A lady mentioned, they say to you, you have 5 more minutes, and then that caused her anxiety. Oh my God, I gotta hurry.
I saw that one. Yeah, so you're in the same group. Yeah, she poured the urine in the sink. Yeah. Yeah, she got all flustered because she was running out of time, and she accidentally poured the urine in the sink and asked, am I going to pass? And unfortunately, the sad answer is probably not.
Like a normal patient use the basin and then like a safe, like a draw side. like chemotherapy patient, like a HIV patient, chemotherapy AIDS patient, like use the basin and like discard या फिर like sterilization.
You're going to go by your facility policy. Your facility will tell you how to handle that. Some patients, we use disposable items. Some patients, we use disposable. Some patients, we will disinfect. It depends on your policy. Depends on your policy. Yep. Yep. So if I have a chemotherapy unit, okay, chemotherapy unit, radiation oncology unit, those basins are probably going to be disinfected. If I've just got a orthopedic unit, those basins are not going to be disinfected. Facility policy.
So I didn't know there would be urine for the test because I thought it was a mannequin.
Okay, so we have 3 skills that are going to impact this. The first is bedpan. You're going to get all of this at the class 7. The last week is all toileting. So bedpan. That's a simulation skill, but it's live patients. So you might be sitting on a bedpan, but you're not actually going to pee in it. So we pretend. But we pretend. It's pretend urine. It's nothing actually in there. But we don't want you to dump that pretend urine in the sink. Now, catheter care. I'm sorry, peri-care. Let me back up. Peri-care is chucks. So there's nothing to dump there. But we have basin of water. Remember, we don't put washcloths back in our basin, so it's just water. Water can go in the sink, but that one gets really confusing for students because of where we're washing. We're not putting the washcloths back in the water, so it's just water. Can go in the sink just fine. Now, the last one is emptying the drainage bag, and that's a real skill. We have a drainage bag, a catheter bag, and it has yellow water in it that looks like urine. It's not really urine, but it has yellow tinted water. And when you take it out of the bag and into a cup, you're going to think it's urine. If I didn't tell you it was yellow water, you would think it's urine. That's the skill that she's talking about. And because we take it out into a container, this container to measure it. And then you dump that. This has urine in it. So where does it go? In the toilet. Right.
And then for the urine skills, would you disinfect?
No. For the test, we simply rinse it, dump it in the appropriate place, rinse it, dry it, store it. That's it.
Like one for water and one for urine, it's not going to be the same one.
Say that again.
It's going to be 2 different
Wash basins?
yeah, like it's
Nope.
one for urine and one for
Okay. Urine goes in a bedpan or this cup. Urine does not go in this basin.
yeah, so it's gonna be 2 different.
Yeah. Good? Okay. So we dump it wherever it normally goes. We rinse it. We dump the rinse water wherever we put the stuff. Everybody good with that? Then we're going to set it down because you can't hold it and disinfect it at the same time. So you set it down. Spray it if you need to. We're going to skip this step for the test. We do not disinfect for the test, but we still follow the process. So we dump it, we rinse it, we dump it, we set it down. We skip the spray, but we have that step if we need it. We have an opening for it. Then we pick it up with a paper towel. We dry the inside with a paper towel. We dry the outside with a paper towel. And then we get a paper towel to get our supplies that we're going to put away and open the drawer with. Because you don't want to touch those supplies with dirty gloves. You don't want to touch the drawer with dirty gloves. And then we throw all of those paper towels away. Good? You're going to see that over and over and over and over. But the thing is that you have to remember for this particular principle, I'm making this a little bit more complex than the test does because I want to approach this when you're really going to use it in a clinical setting. The test, rinse, dry, store. That's all they care. They're not looking at all those paper towels. They're not looking at you touching the drawer. That's not infection. They're not grading you that harshly on infection control. I want to, because if you got urine covered gloves and you're touching this drawer, who else touches that drawer? Patients, family members, housekeeping, right? We don't want urine on the outside of that. So that's where that paper towel becomes important. Good? Good. All right. And then we have the closing. We're going to make sure the patient's in a clean environment, that the bed is in the low position, the patient is comfortable. We need to hear that word, comfortable. We're going to address their preferences. They need to be covered at the end of the skill. Clothing or sheet, I don't care, but make sure they're covered at the end of the skill. Open the privacy curtain, give them their call light, and I don't care how you do all of that stuff. Just get it all done. Once all of that is done, though, then we're going to go clean those cooties off of our hands, chart if necessary, and then wash our hands again, because our cardinal rule is end skill with clean hands. Good? All right, we also learned hand washing. I'm going to shortcut this for you. 20 seconds. Turn the faucet on. You don't need a paper towel. Wet your hands. Get some soap. 20 seconds of friction. Move to your nails. Rinse. Don't touch the sink or the faucet while you're rinsing. Tap to keep the water in the sink. Dry. And throw those paper towels away. We learned pulse. Pulse is a measurement of how many times a heart beat. You use the radial pulse measured at the wrist. We're going to count for 1 minute because our care plan told us to. If the care plan doesn't specify, 15 seconds and multiply that by 4 is perfectly okay. Normals between 60 and 100, don't use your thumb. Use 2 fingers, use your fingertips, not the flat part. And this is a documentation skill, so you have to write it down. In Florida, we're going to count with 2 evaluators. Good? We also learned dressing a resident with a weak arm. You want to make sure that you allow them to choose their own clothing, that you get the clothing first before you undress them. You're using a privacy blanket and the privacy curtain to ensure privacy. Even though we're dressing them, keep them covered as we're going through the process. You're going to put on pants and socks. I don't care what order you do that in, but when we get to the shirt, the order matters. We undress strong arm first, and we dress weak arm first. Call light goes in the stronger hand. Make sure you support the extremity as you move it. Your patient should look good at the end of this skill. This skill, more than any other, your patient's appearance is graded. Okay. We did not do range of motion. Hand and nail care, mini-mani. We're going to get water. We're going to let our patient check it. We're going to put the hand in the basin to soak. Take it out and put it on a towel to wash. Bring your washcloths out. No drippy wet washcloths, please. Apply soap to the washcloth, not the water. And wash all surfaces. Put it back in the basin to rinse. Take it out and put it back on the towel to dry it. Then you're going to take an orange stick, beveled end, clean under the nails, wiping it off in between each nail. File the rough edges in one direction toward the center. Apply lotion and wipe it off. We learned how to make an occupied bed. Clean rolls toward me, dirty rolls away. This is a great party trick. You're going to change that bottom sheet a half of the bed at a time. So you're going to roll the dirty sheet toward the patient, tuck it under them, put the clean sheet on, roll it towards you, tuck it under the dirty, go around to the other side of the bed, take the dirty sheet off, smooth the clean one out, make sure all corners are secured, put the top sheet on. We want to secure the bottom of the sheet using hospital corners and then loosen it over the toes. Change the pillowcase last. Limit the amount of time that patient is without their pillow. It's uncomfortable, especially if your patient has any sort of breathing difficulties. If your patient is overweight at all, that head being lower than the torso, thank you, head being lower than the torso can actually cause a restriction in breathing. So limit the amount of time without a pillow. Good morning. Question on the skills test. What should we do if we can't find the patient's pulse on their wrist? Great question, Leonie. That is a very good question. So Keep trying until you get it. But this is where practice is going to come in. So the first thing I'm going to tell you is you're probably in the wrong place. Okay. So if you can't find the pulse, the first thing I want your brain to go to is I'm probably not on target. So what a lot of people do when they're taking the pulse is they accidentally go down here. You're not going to feel the pulse. There is one down here, but you're not going to feel it. It's too deep. You have to make sure you're at the thumb, okay? Right here at the thumb, the bendy part of the wrist at the thumb. The second mistake that people make is they go down here. They might be at the thumb, but they're way down here. And you've got so much muscle and tendon and fat there that you're not going to be able to feel the pulse. So you want to be at the lines. So if you can't see lines, you're not at the pulse. If you're not on the lines, you're not at the pulse. So make sure you're at the thumb, on the lines, way up at the top. Down here in the middle is not where the pulse is. You want to be way up at the top on the thumb side of the wrist at the lines. I'm going to have to create something for that.
And maybe apply a little bit.
Yeah, so start light. Good point. Start light and gradually increase your pressure until you feel it. Don't be afraid to go too deep. A lot of students, especially young people, you're afraid you're going to hurt somebody. You're not going to hurt somebody. Put your fingers there and press deep. You're not going to hurt anybody. Okay. Don't be worried about hurting somebody by pressing too. I mean, if you're going, that's a little, that's a little different. But just to take the pulse and put your thumb, you probably aren't going to be able to put enough pressure doing this to hurt anybody. I mean, even if you squeeze as hard as you can, you're probably not going to be able to hurt anybody just because of the way your hands are positioned. It's a good point. Hope that helped, Liani. All right, look how much you've learned. You've learned a lot. We're going to jump into today's lesson. All right, here we go. So if we're doing a review of the principles, right, we just went over all of these. You proved to me that you know them. If you're looking at that back wall, I told you that by the halfway point, by week 2, by class 4, you would know almost everything on that back wall and you would not have to go home and memorize it. And here we are. You've learned it all. And I know you've learned it all because you just recited it to me. Okay. So we have one principle to go. That's it. Just one. And those are shoe rules. And it's actually a pretty easy principle, but there's a lot of why behind that principle that we're going to have to go over. And we're going to get to that a little bit later today. All right. So remember that we have the care plan sets, the yellow ones, and we have the care plan cards available for you to purchase. And Jake needs to make a price list, I think. Jake needs to make a note to make a price list, I think. All right. So let's go to page 138. Can you guys tell I'm a fantasy girly? I am all about the dragons. All right. So if you're looking at page 138, this is our overview. Yes.
Last week we went through the skill book. What pages did you go over specifically so that I can read them?
So do you have your syllabus?
Not with me.
Okay. If you need a new one, let Jake know. He can get you one. Okay. But when you're looking at your syllabus right here, okay, this is the rows are per class.
Okay.
So when you're looking at, for instance, let's say last Monday, okay, right here, it tells you the page numbers.
Okay.
It tells you the skills. It tells you the lectures we went over. And then over here is some additional activities that we did. So all of that information is going to be there on that row.
Thank you so much.
You're welcome. All right. So here's another exciting thing that we've got going on. Do you see how these pages on my screen are color, but in your book, they're black and white? This is how we've done the book for years, because to print in color is very expensive. Yeah. Yeah. To print in color is,
$23 and this is black and white.
wow. Yeah. To print in color is very, very expensive. But we are going to offer this as an option. So for future classes, this isn't going to benefit you guys, unfortunately, but for future classes, students will be able to choose the book in either black and white or color for an additional charge. So I'm going to ask you guys, if you had an option to pay $20 more for the color version of the book, how many of you guys would stick with the black and white? Who would stick with the black and white? Okay, price conscious. How many of you would consider upgrading to color? Okay. And that's kind of what I'm thinking, is that the majority of people are going to stick with the black and white. And I think that overall it works, right? Because you've got the color one on the screen as I'm teaching. And I think overall it works. And that's why we've kind of done it that way for a long time. But I'm getting a whole lot more requests for color. So it's something that we are going to be offering future classes. All right. So if we're looking at this along the side, I'm not going to stand up today. My leg hurts. Along the side, you can see all the principles that are involved. We have our skill-specific steps we'll get to in a minute. We've got our short version. All those principles are spelled out for us. And then down here is our test-specific information. Somebody with your level of experience should be able to complete this skill in 8 minutes or less. Yep. And I say that because I don't want you to feel the pressure, right? So here's the problem. This is a problem, by the way. It's actually a very serious problem for you guys for the test. When you are practicing for the test, you aren't comparing your performance to other yous. You're comparing your performance to me. Because you see me do it on the videos. We talk about it in class, right? I'm the best possible performance for this skill. So when you're doing the skill and you're fumbling all over the place and you're umming and ahhing and you can't remember the steps and you have to stop and right. And oh my gosh, I forgot to get a washcloth. I forgot this. And you're all over the place. You tend to think I'm going to fail this skill, because you're so all over the place. Guys, that is normal. Don't compare yourself to me. I've got 30-something years experience. I can't make this look hard if I tried. I do this stuff in my sleep, literally. 2 o'clock in the morning, okay? Do it in my sleep. So when you're practicing, I don't want you to compare yourself to me. That's not how the test is grading you. The test is comparing you to other yous. So if it takes you 8 minutes, it takes you 8 minutes. My video, I do it in like 4.5, right? But you're not going to be that fast because you're new, and it's okay to be new, which is why I say somebody with your level of experience, which is none, that takes that pressure off of you. Good? Make sense? All right. This is going to be a live testing student. That means that somebody with a pulse is going to be laying in bed, that you can get them to do what they're allowed to do according to the care plan. Okay, so our care plan is going to tell us what they can and cannot do. You can work with them. This is much harder to do on a mannequin. You really do need a live patient for this. That person will be positioned in bed, and documentation is not required for this skill. This is probably one of my favorite skills to do. This is an awesome skill. Making an occupied bed, I really like that one because it's a Houdini trick and very physical. But this one is probably my favorite because you can get somebody super comfortable. And I'm all about making somebody's day better, right? That's kind of my MO in life. So for me to be able to get somebody in a super comfortable position and have them, you can actually see them physically just kind of melt because you've taken all of their physical stresses away. There's just a lot of enjoyment and satisfaction that I get out of that. So this is one of my favorite skills to do. Okay. All right, so let's learn how. Page 139 at the top of the page has our care plan. step-by-step instructions, and at the bottom of the page, we've got some supplies. Now, this is a longer skill. It's got a lot of steps to it, so we don't have the review questions here like we do in most skills. Turn the page, though, to page 140, and you'll see the review questions at the top of that page. If you guys are not doing the review questions when I'm going over these skills, or, after learning the skills, you probably should. Those review questions are going to prove to you that you have the important points of those skills. That's why this is a workbook style. All right, so let's take a look at that care plan. It says, position the resident on his left side. Patient requires support to remain on his side and is unable to assist with turning. Underline that word, turning. Unable to assist with turning. Does this say, it's care plan's at the top of the page on 139, top of the page, 139. Does this say your patient is immobile?
No.
Does it say they're paralyzed?
No.
Does it say they can't move? What does it say? They cannot turn on their own, unable to assist with turning. So I do not want your mental brain to put a paralyzed, invalid, unconscious patient in that bed. That is not who this is. And yet that is who your brain will try to put in that bed. Not who this is. I want instead for you to imagine a patient who just had major abdominal surgery. We cut them from here to here. Their whole abdomen was opened up. We went rooting around in there. Put everything back, not really where it belonged. We just shove it all back. That's really what we do for real. And it'll sort itself out later, eventually. And then we sew it all back up or staple it back together. This patient is not going to be able to take this part of their body and put it over here, right? Their abdominal muscles aren't even talking right now. They're not even waving at each other. They're not going to be able to turn on their side. Make sense? That is who I want you to picture for this skill. We're going to ask that patient, can you scoot toward me? Because remember, if we're going to roll somebody on their side, we've got to scoot them toward us first. This patient can scoot. That type of patient can scoot. They just can't roll. Got it? Now, what happens if you have a patient who can't scoot? Because that's where your brain is going. Hold up. Wait a minute. What if they can't? Well, we would use one of a few different methods. Now, if I'm not sure which method to use, who should I ask?
The nurse.
The nurse. But here are my methods. I could use a draw sheet. Now go to page 140. At the bottom of the page, it talks to you about draw sheets. I could use a draw sheet. A draw sheet is a sling. It's a top sheet that we fold in half lengthwise. Okay, so if this is a top sheet, right, I don't fold it this way. I fold it this way, long ways. And then I place it on the bed underneath the patient with the folded edge under their shoulders and the two pieces that come together under their legs. And now if I want to move them, this becomes a sling. I can use it to lift their body weight and pull it toward me. Draw sheets are awesome. Awesome. But it's not the only solution we have. There are some situations where draw sheets are not indicated. I won't go into all of those. That's a nursing problem. As a nurse, I have to figure out when draw sheets should be used and shouldn't be used. But that's a nursing problem. But if I can't use a draw sheet, which is my go-to, maybe I can move my patient in segments. So head and shoulders, torso, hips, legs. Move them in segments. In some cases, I may even have on the care plan that we're going to use a slide sheet. Now, these things are amazing. They're like space age. And in fact, I think NASA actually invented the material. NASA invents everything cool. These are super slippery fabric pieces that go underneath the patient. Remember, clean rolls toward me, dirty rolls away, right? So we put it under the patient and it almost levitates the patient. You can move somebody with like 2 fingers because it removes the friction. They're amazing. Problem is they're extremely expensive, very expensive. And that means that your facility isn't going to have it out where anybody can steal it. It'll be locked up in the supervisor's office. You'll have to sign it out so we know who's got it so we can come find you if you don't return it. And you'll have to use it and then sign it back in. So they're a little less convenient, but in some situations, it reduces the workload on the patient, which is what I'm looking for. So how would we know which method to use on the patient? Easy answer, the care plan. If the care plan doesn't specify, dealer's choice. Yeah, or you could ask the nurse, but dealer's choice. Okay. In this case, says my patient can't roll, but I can ask him, hey, can you scoot toward me? Super easy. Got it? Got it? So I have a solution for every problem that you could potentially come up with. And if I don't have a solution, I'll find one. All I have to know is there's a problem that I need to solve. Good? So do CNAs solve problems? No. Make sense? All right, so we know all of these principles. The principles I need to do this skill, we know all of them. We know to follow the care plan. We know to do the opening. We know to evaluate if we need gloves. We know to use a barrier on our table. We know to use a privacy blanket because our patient's going to be uncovered. Now, privacy blanket on this one, I am going to time out real quick. Okay. You don't have to use a privacy blanket. You can just keep the sheet on. Perfectly okay. Perfectly okay. But the problem is that I've got to put a pillow between their legs. Now that sheet on the patient, pretty restricted down there, not a lot of room to work. So I prefer to use a privacy blanket and pull that sheet down to get it out of my way. And now I've got free access to everything that I need to work on. And then I'll take the privacy blanket away at the end and pull the sheet back up. But if you choose not to use a privacy blanket, that's okay. You will see some videos out there where people don't use privacy blankets. The person working with you on the test, the other tested candidate, may not use a privacy blanket, not an automatic fail. It's okay. Good?
For the draw sheet, is it 2 people?
So we use a draw sheet alone to pull a patient toward us.
Okay.
But if we want to move this patient up in bed, patients creep. I call them little caterpillars. Patients creep. Patients always creep down to the bottom of the bed. I don't know why, because like there's no extra gravity down there versus up here, but patients tend to creep to the bottom of the bed. So if we can't get our patient to move up on their own, then we have to have 2 people, one on each side of the bed. We use that draw sheet as a sling and boost. It's called boosting. We boost them up toward the top of the bed. I swear there's going to be more gravity at the bottom of the bed or something. I don't know. It's weird. But yeah, you'll help. And people tend to work in groups. Like you'll find your person wherever you're working and you'll, hey, if you'll help me boost, I'll help you. And then the teams of 2 will go in and just move everybody up to the top of the bed. And it's crazy, but it works.
And then whenever you're shifting them towards you, like it's just yourself.
Yeah.
Do you meet the draw sheet? Like
No, you're just going to work on the one side and just pull them. Yep. Just pull them.
Okay. Thank you.
You're welcome. All right. Okay. So what we need to learn for this skill. Oh, I'm sorry. Let me go back. I didn't finish going over my review. All right. So privacy blanket optional for this one. Linen rules always apply. Don't hold anything up against your uniform. So for this skill, we're going to get 3 pillows. You can see the 3 pillows, they're down here. Jake, are we missing a pillow?
It shouldn't be.
I only see 2 in there.
Still one in the bed behind you. Maybe maybe got relocated.
Yeah. Make a note, please,
Yep.
to remind me to look. All right. So you'll need 3 pillows. If they're low, that's easy. But if they're up high, and in most testing centers, they're up higher, so you have to pull them off the shelf. You don't want to pull them and hug them. Okay, just pull them and keep them away from your uniform. Please remember that rule. Every testing center is a little bit different with how they have their supplies handled. You'll see this in the video that I'm going to show you. My pillows are up high and I'm short, so I really kind of have to reach to pull them, but I don't let them touch my uniform. Down here is a little bit easier. You can get them one at a time and just put them on your table, and no big deal. Most testing centers are now moving to a situation like this where it's a little bit easier. Okay. But go with what you got on your testing center. Just remember, don't pull them against your uniform. Patient always has to be in the middle of the bed. Remember that. So after the turn, they're in the middle of the bed. This is the #1 step for this skill that fails students. Because you, again, main character syndrome, here we go again, right? You focus on your steps, your performance, your skill, right? What you are doing. And you'll pull the patient towards you, you'll roll them up on your side, you'll get your pillows in place, and you'll never once look at that patient, right? You're focused on you, your steps. Who is the test about? The evaluator is looking at where that person is in the bed. If you scoot them towards you a little bit and roll them on their side and they are super close to the edge of the bed, it doesn't matter how pretty your pillows are. Does not matter. You want to stop and look at your patient. If you roll it, especially if it's a larger patient, because they can only scoot so far, right? So if you scoot a patient towards you and roll them on their side and they're not in the middle of the bed, keep working at it until you get them in the middle of the bed after the turn, because that's what you're being graded on. So during the test, remember I said they have to match you up, right? You guys remember that? So this is one of those tricky skills. We're going to turn somebody on their side and then put a pillow behind their back and tuck it in a roll so that it keeps them from rolling back onto their back, keeps them on their side. Make sense? If I've got a little teeny tiny person, not much meat on your bones, you don't hold that pillow in place very well. There's not enough body there to tuck that pillow under, and it tends to flop out. So I'm not going to use you or you or you for a patient for this skill. But I also don't want to use somebody that's super large either. Because if you've got somebody that's super large, it's hard to get them in the middle of the bed because of their body. You know, when you get them to scoot towards you, they're super close to the edge of the bed, right? So they only scoot a little bit. So when you roll them, they're too close to that edge. So I want to try to find somebody that is a little bit not hefty, but has, healthy, right? Has a little meat on their bones. It's going to hold that pillow, but not so much that it's going to make it difficult for you. Good. Do you guys see how hard this evaluator job is? Right? They got a lot to think about. A lot more than you thought they were thinking about. Good. And where do they want to be? Yeah, home in their pools drinking their margaritas. That's right. So make it easy for them to get there. Funny story. I was contacted by a prometric evaluator out of Texas, specifically to say, this is what was told to me. Now, this is an evaluator. I owe you a margarita. Yep. Yep. I owe you a margarita. So I thought that was really sweet.
Also, really, it's always being on your left side helps with your circulation, heart. Because I had 2 emergency C-sections, so what you explained, I remember them doing that with me, and so it's usually the left. It's always the left side, or
Right.
usually the left side. No. Okay.
Depending on what the care plan says.
Well, yeah, I'm just saying.
because every patient's going to be different, but you're being placed on your left side for a totally different reason.
I didn't even throw it out.
Yeah, no. So let me explain to you, because I'm really good at tangents. Let me explain to you why you specifically were on your left side after a C-section. In the middle of your body, you have an aorta, right, which is kind of like a tree trunk. It's big. It allows blood to go down to your legs and feet. You've got your vena cava, which is big, that allows blood to come back up from your feet and legs to your heart. Okay, so these are pretty big and they lay one on top of the other. Aorta usually behind, the vena cava slightly offset and slightly in front. Okay, what is laying on top of those two things is baby and all of baby's 8-pound glory, along with an amniotic sac full of liquid, which is heavy, a placenta, which is heavy. So, right, so when we have baby there, it's not just 8-pound baby that's laying on this vena cava, it's like 20 pounds. Now, remember our pulse, right? If we press down too hard on that pulse, what did we do? We smashed it. We kind of cut it off, right? So we got a 20-pound hefty load here pressing on our vena cava, same thing as this, and it's smushing it. Okay, so if we have you lay on your left, and we tell pregnant women this, lay on your left side, it moves baby off of that vena cava. We use gravity. We use gravity, just kind of pushes them off, and it allows circulation, especially if mom's got some swollen legs going on, that type of thing. Okay, yep. So, yeah, left side lying is probably pretty appropriate for that particular situation, but it doesn't work. In med-surg, there's no baby, right? So it doesn't really, you know, that principle isn't going to apply to a different situation because that's very specifically for that situation. Make sense? This is why every care plan is going to be a little bit different. So let's talk about this particular care plan. Okay, let's talk about this one. So our care plan does say to turn the patient on their left side. For the test, it could just as easily say right. Your job is to read. Remember I said to underline it, right? Your job is to read the care plan you are given, because during testing, some of the care plans say right, some of the care plans say left, and what do you think they're grading you on? There it is, following the care plan. Easy answer. Yep. So if yours says right and you put them on their left, you did not follow the care plan. So read what side they need us to go to. Make sense? Good. All right, so let's talk about this. Even though our patient isn't immobile, and I made a big deal out of this, right? Our patient just can't roll on their own, but our patient is not immobile. Since that's where your mind tends to go, I want to talk about immobility a little bit. Sound fair? Because some of your patients will be immobile, and you need to know what to do with that. But it's also going to be on the written test as well. We have to talk a little bit about immobility. Now, immobility is the inability to move on your own. So if somebody can't move on their own, are they taking care of their own toileting needs? No, they can't move. Are they taking care of their own eating needs? No, they can't move. Are they brushing their own teeth? No, they can't move, right? So when we have an immobile patient, that means that we're doing everything. This is what we call total care. Total care. So if you have an immobile patient and it is a total care patient, you can't take care of very many of those because they're going to require a lot of care from you. Now, you can probably take care of 12 to 15 walkie-talkies that get up on their own. They just need a little help with the bathroom, might need to squeeze their toothpaste on their toothbrush. They get themselves dressed. You just lay it all out. You just tell them to go to the dining room, right? You can take care of 12 to 15 walkie-talkies. You can only take care of 2 or 3 max total care because they're going to require a higher level of care. Make sense? So this is a question I get asked a lot. How many patients am I going to have to take care of? Yeah, I don't know. Depends on where you're working, but what does it really depend on? The patients. What level of care do they need? But also, how quickly do they change? If you're in a hospital setting, your patients change all the time. I mean, we give medications and treatments and surgeries, and you can have a patient that before surgery is a walkie-talkie. And after surgery, oh my gosh, they're closer to this, right? And that was all like within 2 hours. So your patients are changing like super rapidly. If you're working in a nursing home, your patients may not ever change, like for eons. I swear, George was here 150 years ago. He's the same. He doesn't ever change, right? So in a long-term care setting, you're probably going to have a set amount of patients and you just do the same. I'm not good in those. Same thing every day. Not a whole lot changes, right? But you can handle quite a few because you got a routine. Now, in a hospital setting, you're going to have fewer patients because those patients are going to need more from you for the most part, and they're going to change rapidly. So do you guys understand that? Got it? That's called acuity. How much care your patient needs and how rapidly they change. Now, unfortunately, healthcare is ruled by politics. I wish I could say it was different, and you young people don't understand enough about politics to get this. Healthcare is ruled by politics. And it really does. So one of the things that a lot of healthcare workers push for is something called staffing ratios. Be very, very careful, and they'll lobby you. Healthcare workers will lobby you. Oh, make sure that you help us get this through staffing ratios. This is great. The problem is because healthcare is ruled by politics, and most facilities are for-profit facilities. Where is it? Where is their focus? Money. Bottom line. Your focus should be on the patient. Their focus is not on the patient. You guys do not see things from the same vantage point. Please keep that in mind. Okay. So staffing ratios sound like a good thing, right? One CNA can only take care of 6 patients. Right. Correct. Well said. All right. So if we have maybe a 1-to-6 ratio in our setting, right? So 1 CNA, 6 patients. That's all well and good. You have 6 walkie-talkies. You get to sit at the nurse's station and play Angry Birds or whatever game you like, because your patients don't need a whole lot from you. You have 6 patients as well, because staffing ratio says 1 CNA to 6 patients. All 6 of yours are immobile. Is that a good patient distribution? But legally, it's okay because we're 1-to-6. When we're talking about staffing ratios, you have to understand that that does not take into account acuity. So be very, very careful with what you choose to support and make sure that you truly understand the whole picture, not just the part that they're selectively selling you on. And this is why it matters. Healthcare is for profit. Their focus is on the bottom line. Their impetus, right? The reason that they are okay with staffing ratios is because they then can point to, you can say you're drowning. I got 6 total care patients. I can't take care of all. Well, it meets our staffing ratios, right? It allows them to cut staffing legally, which puts more work on you. So if you're going to be involved in healthcare, you need to understand that your focus and the people that write the rules focus is not always on the same place.
I would think if you're good CNA and you're helpful, that you would want to help that person that's drowning. How does that really work? That
would be ideal.
I don't sit around and play freaking games on my phone. That's
Yeah.
not how it works.
Yeah, that would be ideal. Unfortunately, that's not reality. Not reality.
And that is because healthcare is ran off politics.
Well, like I said, about 12 years ago, I was a CNA and I worked in 2 nursing homes because of near time. That first one was amazing with what she's talking about. They didn't have a hall of like easy and a hall of hard. That second one I worked at, I started an easy hall, yes, great. A nurse came in, I put in an hour, got the hard stuff over with, the bed, got the time consuming stuff.
Right.
I'm like, I'm gonna get a good day. No, you're gonna go to 200 hall, the hard hall, the hall that everybody quits or gets fired on, and the boss does nothing about it. And I'm like, about more than 6 people are
Total care.
consuming
Yeah.
daily.
Yeah. And a lot of this is going to have to do with your administration for sure. Yeah.
2 different nurses.
Yeah. And yeah. So, gosh, I need more time. I really do. So let me a really brief story about this. When I first started in healthcare, I was working in a nursing home, and it was not a good nursing home. I mean, it was not. It had a bad reputation on purpose. You know, it just wasn't a good nursing home. And there just wasn't enough time to do everything you needed to do. Call lights were going off constantly. Patients were screaming. It was very chaotic. I did not do well there. But we got a brand new DO in, and nobody liked her. Oh my gosh, nobody liked her. I didn't like her. Nobody liked her. She would go into a patient's room, sit down behind the privacy curtain, and hit the call light. And not only did she time how long it took for those call lights to be answered, but she wrote down the name of every staff member from dietary to housekeeping to nursing that walked by that call light and did not address it. And at the end of the shift, you got a summons to come to her office before you left. Now, remember, we go from a very bad nursing home to this. Nobody liked her. And she got rid of staff. I mean, right and left. She got rid of staff, and she hired, but she set her expectations immediately. This is what I expect. There will be no deviation. We are here to take care of the patients. That means that if that call light goes off, you assume it's an emergency. You do not assume that it's a glass of water. You assume that it's emergency. So if you walk by that room, you have just neglected a patient in dire distress. I will get rid of you. Ah, there it is. But we were so used to crappy caregiving that the change was startling, and we didn't like it because people don't like change, right? I was one that hung in there because I could see the potential. And we built a staff that was phenomenal. And this nursing home went from being the worst in the county to being a wait list facility. People were waiting to get in because it had developed such a good relationship, reputation in the community. So yeah, if you have management that is there for the patient, the management will support the staff because you're now all on the same team. But when you have management that is there for the wrong reason, they do not support the staff. And now we've got 3 different competing systems: patients, staff, management, and nothing gets done. So when you're interviewing, these are things you should be looking for. You want to be at the good facility where they're going to support you. Remember, during an interview, you were there to interview them as much as they're there to interview you. Keep that in mind. You're going to be in demand. Okay. And I'm way off topic, but we are all used to me now. We are used to me now. All right. Let's talk about immobility. Immobility affects every single body system, everyone in ways that you don't really expect. When you are immobile, when you're not getting up out of bed, the secretions in your lungs harden. You are at risk for pneumonia. You are not going to be breathing as deeply. There's no exertion, so there's no reason to breathe deeply. And that's going to reduce your lung capacity. That reduces your oxygen on board. That makes your heart beat harder because there's not as much oxygen in the blood, so we got to push it around faster. Your heart is a muscle, becomes weaker because it's not getting any exercise. It's a couch potato right now. So it gets weaker. So we have lung problems, we have heart problems, we have muscle problems. This is the one most people are aware of, muscle problems, right? Because our muscles atrophy. They get stiff, they don't work well, they lose muscle mass, we get weaker. That's a problem. Our cognition gets affected because we don't have all of the nutrients that we need. I'll get to digestion in a minute. We don't have all the nutrients we need to make our brain work well, and we don't have good enough blood flow to get blood to the brain. So cognition gets affected. Plus boredom sets in. Oh my gosh, that's a whole nother thing. But then you've got digestion that's affected. You don't absorb the nutrients. Digestion slows down. We end up with constipation because your tummy muscles, as you move, are what moves food through your small intestine system. Your intestines don't move on their own. It relies on the muscles around them to move stuff through. So no motion, no motion. Your patient's at risk. Do you guys see how all of your body systems are affected? But the one that's affected the most visibly, those are all effects, those are all serious effects. But the one that's affected the most visibly is the skin. And we're going to do a little experiment together. I want you guys to take one hand and put it underneath your leg or your butt. I want you to sit on a hand. You're going to sit on it for 2 minutes. It's going to be uncomfortable. You're going to want to pull it out. Please play along because I want to show you something, okay? This is actually a pretty cool experiment. So I'm going to talk for the next 2 minutes and explain this process. Don't pull it out until I tell you to, okay? So when we have in the body, we have bones. Bones are heavy. They're hard. They don't really give, right? They're solid. Those bones are going to be pulled down into the tissue below it. So when you're sitting right now, everything's being pulled down to your butt, right? So all of your butt, all those muscles and blood vessels, your hips are pressing down on, compressing. When you're laying down, we can see this effect along the back side of your body, the back of the head, the shoulder blades, the sacral or coccyx area, lower back, your the back of your legs, right? All of these areas, your elbows, your wrist, everything that's in contact with the bed surface, your body weight is compressing. Make sense? These are all areas that are prone to pressure sores. And I'm going to explain to you how that happens. It happens because we have solid bone pressing, being pulled down by gravity into the tissues underneath. And it's going to compress the muscle, but it's also going to compress the blood vessels that feed the muscle, the fat, and the skin. Now, remember what happened here when we pressed down and we pressed too hard? We compressed. We cut off blood supply, right? That's what happens here. We have bone pressing down. We have a surface underneath, and you've got all that tissue trapped right in between. We cut off blood supply. Now, this is even worsened when there's wrinkles under that, anything, crumbs, pins, hearing aids, whatever. If there's an object underneath, that's going to cut up into the skin. Now, it doesn't take long for this to happen. So since that skin is caught in between the solid surface and your bone, this is where we're going to see that effect. So go ahead and pull your hand out. Take a look at it closely. Do you see color changes?
Yeah.
Look a little closer. Do you see the pattern of your clothing or the chair imprinted on your skin? That was 2 minutes, guys. Probably not even, because I'm talking fast. I feel so celebrated. So this effect happens very quickly. You guys are healthy, and you still ended up with imprinting on your skin in 2 minutes. What do you think would happen if we left that body there for 24 hours? That imprinting is going to go deeper and deeper and deeper and deeper, and eventually it actually cuts into the skin. And that's how we end up with pressure sores. That is correct. Now, we got this in 2 minutes. We have to understand that our care plans, when we have an immobile patient, somebody that can't move on their own, our care plan is going to tell us how often we need to be turning this patient. That care plan is going to be very important. As a hospice nurse, I know that protein intake has a huge impact on skin integrity. Okay, so if I've got somebody that's not eating a lot of protein, their skin is much more likely to break down. My hospice patients are not eating a lot of protein, so they're at increased risk of breakdown. So my hospice patients, my care plans would have you changing the position every hour based on the need of that patient. So if your care plan says left side, it's important that we follow that care plan. If it says 2 hours, it's important that we follow that care plan, because your patient's skin integrity is going to depend on it. Now, bed sores can get bad, really bad. Bed sores, if they're left unaddressed, can go to the bone in a single shift. And it can take 9, 10, 11 months just to get it to close. I'm not talking healing, just to get it to close. 9, 10, 11, 12 months. Now, have you ever had a paper cut? That's one layer of skin. That's not even like down to your muscle. Certainly not down to your bone. That's one layer of skin, and a paper cut hurts. Now, can you imagine the pain that this patient's going to be experiencing if this cut is down to the bone for months, if not years? Now, on top of that, we've got a brand new body opening, which can potentially let in pathogens and infections. That's right, develop infections. So we have complicated this patient's life in a very real way. A question you probably get on the state exam. You are assigned to change a patient's position every 2 hours around the clock. At 2 a.m., you walk in and the patient asks to not be turned because they want to sleep. What is an appropriate action? A, turn the patient anyway. B, notify the nurse. C, let the patient sleep and change their position later. Or D, label the patient non-compliant. Okay, let's talk about why it's not notify the nurse. Your care plan has already told you what to do. Why are you going to tell the nurse? There's no change. We tell nurses changes. Okay, patient asked to stay asleep, but is that really something that we need to tell the nurse about here? The patient didn't refuse, they just asked to stay asleep. Right? We're going to tell them, I'm sorry, but to keep your skin intact, I've got to turn you. We're going to turn them. It is a tricky question. It is a tricky question. If your care plan has all, but here's the key. If your care plan has already addressed it and given you instructions, why do you need new instructions from the nurse? It says around the clock. We know that patient's sleeping. Now, if the patient refuses, that's different. That's right. If the patient refuses, or
That's what I heard.
yep.
When you were just saying, it sounded like he was refusing. So it is a pretty tricky question.
That's right. So we have to remember care plans are there to give us instructions. If we already have the instructions, we just need to follow the care plan nicely. I'm so sorry, Mrs. Jones, but I got to turn you. We got to keep that skin intact. Trust me, you won't sleep if you got a bed sore. Good? You guys starting to understand the test? That's what this is all about. That's why I'm writing this. Okay?
Ma'am, bed sores patient change the position 2 hours, 4 hours, according to nurse.
Yep, we're going to get there. Yep. So we're going to change them even while sleeping. You do this on your own. You have the same problem. I mean, you have it 2 minutes. You got lines, right? Your body does this on its own, even when you're sleeping. You change position, you turn, you roll, you stretch, you move. And that's all because your blood vessels need to be relieved. That compression needs to be relieved. And this is why you move during the night. You just might not wake up for it. We got to wake our patients up to turn them. And we're going to do this every 2 hours around the clock or as directed by our care plan. And this is what's called a turning clock. You can, CNAs can actually make this. Most places have one, but we put it on the wall. So if I walk in the room at 1:15 in the afternoon, I should be able to look at this and see exactly where my patient should be. So at 1:15 in the afternoon, where should my patient be? Right side. If I look at the patient and she looks like this, what does that tell me? Yeah, I need to move her, but what does it really tell me? Who knows how long? So this patient could potentially have a bed sore. I've got to look at their skin. But what it really tells me is my CNAs are not following the care plan. We're going to have a problem. You and I are going to have a discussion because I am trusting my patients to you. Ultimately, I am liable. If this patient has a bed sore, I'm the one on the chopping block. I can't say, well, the CNA didn't turn them, because ultimately the responsibility lies with me. So if you're my CNA and I've got a total care patient, I'm probably going to be asking you, did you turn them? 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 And you're going to get sick of hearing me, but I have to do that because until we develop a working relationship and I learn to trust you, I'm not going to trust you, not with my license. I worked way too hard to get it. So if you're not the type of person that's okay with supervision, if you don't like people checking on what you're doing, if you get an attitude about it, you do not belong as a nursing assistant. Okay? Accountability is essential here. But it can also help you because if you're busy with somebody else, you can go to the nurse and say, hey, I'm not going to get to that turn. Can you take care of it? Don't hide it. Don't say, oh, I've been too busy. I couldn't get to it. You need to tell me. Communication. Work as a team. Good? So this kind of tells us how we're going to do this. We start out on the back like this. Then we go to the right side for 2 hours. 2 hours later, we're back on the back. 2 hours later, left side. 2 hours later, back on the back. Right back, left back, right back, left back. Notice there's nothing on the stomach. Do not put an immobile patient on their stomach unless the care plan specifically tells you to. Because if your patient can't raise up off their rib cage, they will suffocate. That's why we don't put babies on their tummies. Don't put them on their stomach unless the care plan specifically tells you to. Now, this is interesting to me. I've been teaching this a long time. And during COVID, we had an ICU critical care nurse that discovered that if she put the patients, the COVID patients who were ventilated in the ICU, she had one that had some skin issues. So they have these special beds that you can rotate the patient. She turned the patient on their stomach, and the special bed kind of harnesses them in place. So they're, not laying, they're not, the bed turns. I'll put it that way, kind of like a rotisserie, right? The bed turns. She actually found that the patients ventilated better. Their VQ ratios were better. And so that actually, they did, that created a study, right? And then they did some experiments, and they looked at the data, and they extrapolated whether this is a good idea for, if this is guidance, is this what we should do, right? But she took an action based on her nursing judgment. She made an observation, and that prompted some investigation. CNAs don't get to do that. But if that's something that interests you, become a nurse. Okay. So if you were taking care of COVID, now I've told you back, right, back, left, back, right, back, left. But if you were working in the ICU during COVID, your care plan may have said stomach. Now, even though you've learned this, when you're working in that setting and your care plan says stomach, what would you do? Would you go by this? What are you going to do? Care plan. Do you see why I have to teach you about the care plan? Good? Make sense? Okay. This is going to cover 90%, but there's always a situation that it's not going to cover, that you're going to have some different guidance. You need to understand that what we teach you here is theoretical. The care plan is real world. Do you guys understand the difference? Okay. So keep the patient in the middle of the bed. We've talked about that at length, especially if they've been turned on their side. During this skill, if your patient looks like this with pillows behind them, you will fail. Why are you going to fail? Yeah. Yeah, they're too close to the edge of the bed. Not only that, this patient's on their right side, and the care plan said left. That is correct. Good. You want your patient to look like that. Good. Yeah. This happy coincidence, where was it? This was a happy coincidence because I make all these graphics. I didn't do this on purpose with the right side. I didn't do that on purpose. I actually found that out last class. I was looking at that going, that's cool. That's a teaching moment. But yeah, I do all of these. I make all these graphics. So in order to get the patient on their side, we're going to scoot them toward us and then roll them away from us so they're in the middle of the bed. Then we're going to, you can use a draw sheet to scoot them towards you, but then we're going to prepare them for turning. Now, this is what sets this skill off from all the other skills. Okay, this is the part that you have to learn. If I am going to turn a patient on their side, and they can't really help, right? If I'm the one that has to do the work, patients are long. They're not short and compact. They're long. They're gangly. They got all these extremities, right? And that makes it difficult for us to turn them. So what I need to do is get those extremities pre-programmed for the turn. And that's what this part is all about. This will make your turn super easy. Remember I said I used to work with bariatric patients, larger patients, right? I could myself, and I was much littler then, I could turn a patient about 400 or 500 pounds with no problem, all by myself, just using this process, this technique. So the way this works is you got to know which way you're going, right? Right side or left side. You have to know which way you're turning the patient, and you're on the other side of the bed. So if I'm turning them on their left, I'm on that side of the bed. I'm going to turn them this way. Good. That's her left, not mine, hers. This is her left arm. All right. So I'm on that side of the bed. I've scooted her toward me, and I'm going to turn her onto her left side. To do that, furthest arm goes up. Furthest arm. Closest arm crosses her chest. Remember, I'm on that side of the bed. Furthest arm goes up. Closest arm crosses the chest. If I were turning her on her right side, I would be on this side. Furthest arm would go up. Closest arm crosses the chest. Good. Furthest arm up. Closest arm crosses. Close cross. Good. Now we're going to go on to the legs. The closest leg to me is going to bend at the knee with a foot flat on the bed. The furthest leg from me gets angled out, bent and angled out, so it's laying on the bed. So you end up with something like this. When you end up with something like this, you put your hand on their shoulder and one on their hip, and you just roll them. And they roll super easy. No stress on you, no stress on them, no brute strength required. If I try to take this mannequin and push her over on, that's a lot of brute strength, right? That doesn't work. If you furthest arm up, closest arm crosses, closest knee bent, furthest knee angled, it's a very simple roll. Super gentle, super easy. But you have to learn this. Furthest arm up, closest arm crosses, closest knee bent, furthest knee angled.
Do you find that dementia patients have a hard time with the instructions of that?
Well, it depends on your patient. Yeah, it depends on your patient.
You could have a position on yourself if they're mobile.
Right. Yeah, I mean, yeah, I'm going to put all of this in place. You know, I'm going to put the furthest arm over. I'm going to put the closest arm across, right? But if I've got a dementia patient who is not, who's able to get out of bed, this doesn't make any difference, right? This is only for dementia patients that are bed bound. And if they're bed bound, if they're that far into dementia, they're probably not resisting. Okay. So I have removed the privacy blanket on these graphics, but no, during the skill, I'm going to have them covered. Yes.
So the side that they roll on is going to be the side that their arms
Up. Right. So they're not laying on that shoulder.
Right.
That's the whole point of it. Yep. We don't want them laying on that shoulder. All right. So once we have furthest arm up, closest arm cross, closest knee bent, furthest knee angle, we roll them on their side. We want to make sure to stop and make sure they're in the middle of the bed. If not, do it again. Roll them back onto their backs, get them closer to you, and then roll them again. So don't ignore this. Do not ignore this. The evaluator does see it. I guarantee you the evaluator sees it. They're looking for it. All right, then we're going to put a pillow behind the back. This is the hard pillow. This is the hard pillow. We're going to take one pillow. Oh, too much time at the computer. My leg hurts. Okay. So I'm going to take this pillow. Thank you. Thank you. Okay. So I'm going to take this pillow. I've got my patient on their side like this, right? I'm going to take this pillow and I'm going to lay it up against their back like this at an angle, like a ski slope. Woo! Okay. Not flat, at an angle. Now, once I get this at an angle against their back, it should be, kind of like this. I'm going to take this edge and tuck it underneath the patient. But to do that, I mean, they're right there. I mean, I can't just do, I have to go down and then forward. Okay. So this goes down and then forward. And that's why I need it at a slope to be able to go down and then forward. We want their body weight to hold this pillow in place. That's why we don't want a super skinny person. We need their body weight to hold this in place. Once we have this edge underneath the patient, then we roll this one up and do the same thing. Down, roll it up, down and under, so that their body is laying here, holding this side in place, and we have a roll right here. Yeah, not today, but yes, yes, I know. Practice. Yes, we will have some practice time. All right. So that's the back roll. Then we put a pillow in between their legs, specifically between the knees and the ankles to pad. And when we do this, we want the top leg slightly offset. You don't want the top and bottom directly on top of each other. Bring that top one out just a little bit so that you don't have all of that weight on that bottom leg. Then we're going to put a pillow under that top arm. That's going to hold that arm up in a neutral position. It relieves stress up into the neck and the upper back, can prevent headaches and muscle spasms and things. We want that arm in a neutral position. When you put this pillow in place, do not have it over the face. You can see here it's pretty clearly out of the face, but it's really easy when you put that pillow. If you angle it too much, it'll be under the or over the patient's face. Make sure you can see their face. And then we're going to adjust this pillow. You see how the arm is like this, right? We're going to adjust the arm so that it's underneath this pillow and the pillow is just under the head and neck, not that bottom shoulder. So get them comfortable. When you get somebody like this, right, we've got them on their side, we've got a pillow supporting their back, one between their legs, one supporting that upper arm. We've got that pillow under the head. Their hand is tucked. This is the most comfortable position you will ever be in. This is amazing. Patients will sleep like a baby. And that's why most of your patients aren't going to complain. Because this is tucked in for sure. We want to make sure that we put that call light under the pillow in the bottom hand. Don't put it in the top hand because when you do, that cord goes right across their neck. We don't ever want any choking hazards. All right, so we're going to use all of these to check off this. Let's see how we do it. We're going to follow that care plan. Care plan is going to tell you which side to turn the patient on. Make sure you put them on the correct side. We're going to do our opening. Knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to turn you on your side. Is that okay? I'm going to close your curtain, wash my hands, close the curtain, wash my hands, get my supplies. I'll be right back. We're going to get a berry, or we'll decide if we need gloves. So let's time out here on gloves for a second. You might be a patient for this. We've talked about that, right? You are fully clothed. You are holding on to all of your body fluids like a champ. There is no risk to the person doing this skill when you are the patient. They're not coming into contact with anything for the test. So chances are for the test, you do not need gloves. And it is way easier to tuck these pillows without gloves. Take the gift they're giving you. In a clinical setting, if your patient is immobile, they're also incontinent. Do I need gloves? Yes. Right. So in a clinical setting, most of the time you'll need gloves for this. For the test, you will not. Yes. So we're going to have one behind the back, one between the legs, one under the top arm, and then just adjust the one under the head that's already there. Ankles. Okay, so we evaluate if we need gloves. We're going to use a privacy blanket over the patient when we take their sheet down. We're going to use our linen rolls, not shake them, snap them, or hold them against us. We're going to make sure the patient's in the middle of the bed using scoot and roll. We're going to use the skill-specific steps. And we're going to do the closing at the end. And that's how we're going to get 100% on this particular skill. Remember, this care plan is only for this patient. Every care plan I write is unique because every patient I care for is unique. Good? Good. You know, every one of you in here, you're all pretty healthy. You know, you want to be CNAs, right? You're all pretty competent. But I am still, you guys don't realize this, I am still tailoring my instruction to each one of you independently because I scan the room and I see when I see your expressions. I see when I've lost you, when I've gone too far off track and you're getting bored. I see that eyebrow furrowing when you're trying to work out what I'm saying, so I expand on it. I am tailoring my instruction to each one of you as you sit there and you have no idea I'm doing it. This is nursing in action. Even though you guys are all students, you are all individual and you have individual needs. Patients do too. Okay, good, good. All right, Jake, we're going to watch this video and then we're going to take a quick break as soon as the video is done. And then we are going to rush right into the next 2 skills. 3 skills. Oh my gosh. Oh, all right. We're going to rush right in. All right, Jake, sideline position, please.
Hello.
Good morning, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I need to turn you onto your left side and use some pillows to secure your position. Is that okay?
Yes.
Okay, I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. Now that I have clean hands, I'll get clean supplies. We're going to start with a barrier, and we'll place it on the overbed table. And this gives us a clean place to put our clean supplies. Now I'll get 3 pillows. And a privacy blanket. We'll bring this over to the side of the bed. Okay, Mr. Jones, I'm going to start with a privacy blanket. I'll place this on top of you to help protect your privacy and to keep you warm while we do this skill. So I'll take the privacy blanket and unfold it, being careful not to snap it or shake it. We'll lay it right over the patient on top of the sheet. Can you hold that for me? Thank you. I'm going to pull the sheet all the way down to the end of the bed. This just gets that sheet out of our way. Okay, Mr. Jones, can you scoot your body toward me? Thank you. Now I'm going to position you for the turn. So we're going to take the furthest arm and place it up over the head. The closest arm will cross the chest. The closest knee is going to bend with the foot flat on the bed. And then the furthest knee will angle out. Okay, just relax for me. Thank you. And now I'm going to roll you on your side on the count of 3. 1, 2, 3. So I'll roll the patient, maintaining a wide base of support, and then I'll use some pillows to keep him in this position. So the first pillow will go behind the back. We're going to move the privacy blanket out of our way so we don't tuck it in. The first pillow will go behind the back. We're going to tuck this edge underneath the patient. So I'm going to tuck down and under. This edge will roll up and then under the patient, down and under. And that provides a nice roll. We'll go to the other side of the bed. So this pillow will go between the legs, specifically between the knees and the ankles. We don't want the legs to lay right on top of each other, so I'm going to move the top leg just a little bit forward, and then I'll lift from below and place the pillow in between the legs. That way they're not laying right on top of each other, and the bony prominences are separated by the pillow. We'll cover the patient up. I'm going to take the third pillow, and this one will go underneath this top arm. As the arm droops down, this puts a lot of pressure along the upper back and into the neck. We need that arm in a neutral position. So I'll take the pillow, lift the arm from below, and place the pillow right under the elbow area of that top arm. Now the pillow under the head is under the bottom shoulder. So we're going to lift the head up, move the pillow so that it's only supporting the head and neck, and then we'll place that bottom arm underneath the pillow. We're going to take the call light and place it directly in that bottom hand. Okay, Mr. Jones, I'm going to remove the blanket and pull the sheet up now. So we'll pull the sheet right up over the blanket and the pillows, and then remove that privacy blanket, rolling it into a ball as we remove it so that trailing edges don't contaminate other surfaces. We'll adjust the sheet for neatness and appearance. And we'll open the privacy curtain. Mr. Jones, are you comfortable?
Yes.
Okay, I'm going to go dispose of my linens and I'll be right back. This will go into dirty linen. We'll dispose of the barrier in the trash can. And we'll move the tray table back to storage. Okay, Mr. Jones, is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes, ma'am.
Okay. Is the head of the bed, does it need to be adjusted at all?
No, thank you.
Your environment is clean. Bed is in the low position. I'm going to go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done. All right, any questions on that? It's a short skill. It's an easy skill once you understand everything, but I needed to explain to you about immobility and the effects of immobility because that will be on the written test. Good? We're going to go ahead and take a break. Are you guys okay with me shortening the break just by 5? Let's do a 10-minute break. Is that okay? Because we got so much to get through. All right, so let's take a 10-minute break. I'll put the timer up on the screen and do what you got to do.
I have a couple questions.
Can I, 1 second?
Yeah.
I'm sorry, just give me 1 second. Sorry. Jake, let me have this real quick.
Oh, yeah, sorry. Let me get out of your way so you can sit.
You're good, you're good.
Nope, I'm getting out of your way. Ooh.
Sorry.
No, you're fine. I don't apologize. You gotta take care of that. Trying to change the slide from 15 to 10.
Yeah.
Nope, that's exactly what I'm asking
Okay.
right now.
It's still showing the whole OBS thing on the screen. That's awesome.
Yeah, I know. I have to.
Oh, no, actually, it's not. It was just showing that. That's cool. So just on our screen, it was displaying the OBS.
Okay.
But when you were the live stream itself, only hold the regular.
Okay. Good.
That's
Okay.
good.
I'm sorry. Go ahead.
No, you're okay. So I just don't know why I didn't really get the 6 or
I'm
7.
joining this because me and her both got stuck on the same page.
Okay. So what we're going to do, I can give you the answer, but I'd rather you know where to find the
yes,
answer. Okay. So
Is that foot?
lift top
I
leg
thought that was,
with a flat. Okay.
I
Thank
thought it
you.
was like flat hand because in the
Yep.
video she like lifted with her hand, but
Lift top leg with a flat. See, I don't know what a claw lift is.
that's when you do this. Sorry, can I grab you?
No, yeah,
Sorry.
you're
That's when you
okay.
do like this and then up.
Oh.
So you want to go like,
Okay. Right here.
like this up.
So lift top leg, right? Supporting knee and ankle joints when lifting from below with a flat
Palm.
palm. So that's going to be a palm. And then we're going to go to 7, provide something with a privacy blanket. So, where is it? Let's see here. It doesn't say, but yeah, it's the provide privacy.
Good. Privacy. with the
Privacy, yep.
blanket. Okay.
Yeah, when I wrote those questions, I tried to take them directly out of the text so that it would force you to go back to the text
Yes.
and read it.
I also so yesterday we did the blood pressure. I don't remember what page it was.
Wait, we did what last class?
Blood pressure.
I was not.
Yeah, that's go back and watch the review, but it's not tested. So blood pressure is back
We still
here.
need to know how to do it though, right?
Yes.
I was just if you would be able to also go over those with me, just the ones I haven't. used.
Okay. So let me show you where to find these answers.
And just-
Okay. So right here, page
I also
57.
take a lot of notes, so like if you ever wanted to get like.
Okay. So that's where all of these.
Thank
But
you.
the stethoscope must be used with the ear tips facing
The patient.
and away from you is going to be
Must be used with the ear tips facing.
yeah, it'll be somewhere. Oh, here. The stethoscope must be used with the ear tips facing away from you. So that's going to be away from. Okay. It's best to have the patient rest both feet
Flat.
flat on the floor. Generally speaking, CNAs inflate blood pressure cuffs to only, and that's going to be
I didn't know they were right because we went over it in
yeah,
class. So
yeah.
I thought
So it's all going to be in here. I don't. It's been 2 years since I've done this book, so I don't remember where.
only 2. Is it 180?
Yep, yep.
Okay.
There it is. When taking a blood pressure, it's going to be the first sound,
Okay.
but we got to find it in here. There, right there.
When the first.
Yeah, the first. So yeah, you'll just, these are application questions. So you're going to try to see where that and that one is and write it, you know, what the blood pressure is and determine if
Right.
it's normal. The
Okay.
rest of these will be in the
Okay,
text.
thank you.
You're welcome. I'm going to run to the restroom.
Okay.
Go ahead.
No, ma'am. Test, ma'am, because I come Monday, I leave for 10 minutes.
Say that again.
I go for after 5-10 minutes. My Uber wait.
Oh, okay,
He give
okay.
me the test for Monday.
So for Monday,
Yes.
you have to,
1, 2, 3, 4 chapter.
so 4 gets you up to today, and then 5 and 6 are for Monday, to report on Monday. And then this is for today. Is that right? Class 4? No, this is class 4. Yeah. There you go.
I need a CNA job.
Mm-hmm.
I passed my practical, but I'm not good for learning. But you please give me the practice test separately.
Okay, so in here,
Because I need too much. My baby, ma'am, 15 months.
so here, practice test, and I'll have one by graduation. I've got one I'm working on for you. Okay.
Ma'am, I am in home. I started your online classes, but not sure. You check for Monday. You go for that.
So did you go to the website I gave you?
Yes, ma'am. I have a your website.
Okay, so you were enrolled. We checked to make sure you're enrolled,
Okay.
but you have to go to the site.
Okay.
Yeah. I can't really help you at home. So,
Ma'am, my fees 220 left. I give you
yes.
half pay, half I give you.
Okay, so you
and
still owe?
Yes, see you on, ma'am. Like Monday, just Tuesday.
Yeah, you were supposed to pay before you came to class.
Okay.
Okay, so yeah, I'll definitely need that payment.
Yes.
Okay, thank you. Jake, I need you to make sure
Mm-hmm. I'll verify now.
because
Yeah, I heard.
I got to go to the bathroom. Oh, great.
It was. I mean, it may not be anymore.
Seems to still be. Here, I'm going to take this out for just a minute.
Oh.
1:30.
All right. So we're going to go ahead and get started. Those of you who are still on break, that's fine. Just catch up when you can. Okay. Bless you. So I got to get through these pretty quick because we still have test registration to go through today. So we're going to kind of go into, we got to go into super speed here. All right. Thankfully, this one we already know most of. There's nothing new to teach you here. This is foot care, page 118. And like I said, there's nothing new to learn. So if you look down the side there, you can see all the principles that apply to this particular skill. The skill-specific steps, principles are spelled out for us. And down at the bottom is test-specific information. Somebody with your level of experience should be able to do foot care on somebody within 13 minutes. Do you guys remember hand and nail care? We soaked the hand, washed the hand, rinsed the hand, dried the hand, cleaned under the nails, filed the rough edges, and did some lotion. You guys remember that? All right. Foot care is the same thing, but nothing with toenails. We don't clean them. We don't file them, but we do look at them. So all we're doing is soaking the foot, washing the foot, rinsing the foot, drying the foot, and lotioning the foot. Putting a shoe and sock back on. But the whole reason we're there is to look at the foot. Okay? So there's really nothing new to learn with this skill. It's hand and nail care, just a little lower and no nails. They give us more time for this skill. Even though there's fewer steps, they give us more time. And that's because we have to get on the floor to do this particular skill. That's where the patient's foot is, so that's where we have to be. So instead of our barrier being on the table, we're going to put it on the floor and put our basin on the barrier. We can put our washcloth and towels on the barrier. So we're working on the floor. That also means that you have to get on the floor, and I'm too old for that anymore. But if you want to put a barrier down on the floor for you to kneel on, that's perfectly okay to do. You don't have to. There's no checkpoint that says you have to kneel on a barrier. But for some of you, you're going to feel more confident, more comfortable if you're kneeling on a barrier. If you have bad knees, you can put a towel on that barrier and kneel on that to give yourself a little softer surface. But you can accommodate this. In a perfect world, you'd have one of those little pedicure stools that you can, but they don't have those at the testing center. So, yes. Oh, okay. All right. Oh, let me back up. So, do you see who the patient is? You guys see who the patient is?
Student.
Oh, that's right. So somebody else might do foot care on you. And even if you have ticklish feet, even if you're not happy with people touching your feet, deal with it because somebody else's test score depends on you being cooperative. Good? Good? All right. This person will start the skill in a chair. So step-by-step instructions are on page 119, care plans at the top of the page, and supplies are at the bottom. Now, please bear in mind that on the supplies there, I do not have an extra barrier for you to kneel on. Just remember, if you want to kneel on a barrier, add an extra one in for you, okay? It's not required. Here's our care plan. It says, provide foot care to 1 foot using soap and water. The resident is sitting in a chair and their sock and shoes should be replaced at the end of skill. Now, let me explain that last sentence or that last section. It says their sock and shoes should be replaced at the end of the skill. Now, remember, we're doing this on another testing student, you, right? Victoria, is that right? Victoria. So Victoria is going to show up to testing and she's probably not going to have a clean set of socks in her back pocket. Not very many people walk around with a clean set of socks on their person, right? So in a clinical setting, if we're doing foot care, we're probably going to put clean socks on the patient. Clean feet, clean socks, makes sense. For the test, we don't have clean socks that we can put on Victoria. So our care plan is telling us what to do because we don't have clean socks. What are we supposed to do? Yeah, we're going to put their sock back on. Good? Make sense? So for the test, you should have no questions about this. The care plan tells you what to do. Because if you ask the evaluator, do you know what they're going to say? Read the care plan. Good? Make sense? Okay. All right, since we know all of the principles, let's look at the test-specific ones. Very, very, very similar to hand and nail care. In fact, if you look at them together, they look very similar. We are going to soak the foot in the basin on the barrier. Remember, we had with hand care, we soak the hand in a basin on a barrier. We are going to support the foot as we move it in and out of the basin. What did we do for the hand? Supported it in and out of the basin. Yep. This is a good review for you then. All right. We're going to wash, rinse, and dry, just like we did for hand and nail care. You're going to apply lotion to all surfaces except between the toes. Lotion holds in moisture. Between the toes are already warm and dark. When you hold in moisture, we increase the likelihood of athlete's foot being developed. So don't put lotion between the toes. Plus, it's all icky and squishy and weird and funky, and just no lotion between the toes. All right. The whole purpose you are there to do is to look at the foot. So make sure you're looking at it. Say something like, I'm looking at the foot. Or I don't notice any abnormalities. Or your skin looks good. Or I would report anything that I noticed. Or whatever. But make sure you're looking. That's why you're there. Keep the foot on the barrier or in the basin. Do not put the bare foot on the floor. And that's why I said earlier, you guys remember me saying what can go on the floor? And we all said feet, because that's what I've been telling you. And I said I should fix that. Yeah, it's shoes. The only thing that should go on the floor is shoes. The foot should be on a barrier or in the basin. Don't put a bare foot on the floor. Good? Good? You guys understand why? Okay. All right. And then we're going to replace the patient's sock, removing those wrinkles, and put their shoe back on. That's the whole skill. That's it. That's it. That's foot care. Yeah, I don't. Oh my gosh. When we retaped these videos a year ago, I can't get on the floor anymore. My knee won't let me. It was horrible, horrible, horrible. We had to set this skill up to make it look like I was on the floor, but I'm not. Yeah, I have a real hard time. I can't kneel very well. It hurts. I'm like bone on bone at this point. And being a small business owner, I have no insurance, so I get to deal with it. All right, so we know all the steps here. Let's use those steps to check off our checklist. We're going to follow the care plan. We're going to do our opening. Knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to do foot care. Is that okay? Close curtain, wash hands, and we're going to get our supplies. We will get a barrier first and put it on the floor and put the rest of our supplies on the barrier. But let's talk about gloves. I have said up until this point that we wear gloves if we're going to touch any body fluids, personal skin, or non-intact skin. You guys remember that? But I also have said we're going to wear gloves if it's a maybe. The whole reason that we're looking at the foot is to look for abnormalities. So that is a maybe. Do you need gloves for this skill? Yes, because it's a maybe. Because you don't know. Hands you can see before you get in there. So hands will evaluate. Feet, you can't see the bottom of the foot until you're already in there. So wear gloves, plus it's feet. Yeah, whenever, you just work it in, whenever. Yeah, there's no right or wrong time to get those gloves. Let me back that up. until you actually start the skill. There's no right or wrong time to get gloves. But the minute you touch the patient, you can't touch supplies with dirty hands. So the minute you touch that patient, if you realize you've forgotten a supply, what would you have to do before you go get your supply? Wash your hands. Does that make sense? Good?
That's kind of what I was gonna say.
Okay.
You forget during the skill to take the test.
Right. You can, it's
Sorry.
perfectly
I
okay.
forgot to-
Perfectly okay. You would just wash your hands.
This is gonna sound stupid, but it's just so much like clean hands, clean hands. So you can perform the skill with the gloves on once you have all of the supplies.
Right.
Okay.
Right. You just want to wait to put your gloves on until you're ready to start the wash. You don't want to put your gloves on and then go get your supplies. The first thing your gloves should always touch is the patient, not the supplies. We're going to put a barrier this time on the floor. We'll put our basin and our supplies on that barrier. Linen rules apply. Don't put them on the floor. When you're done using them, they go on the barrier, not directly on the floor. Right? We've learned that, right? Right?
So how would it apply if we're touching like the soap? Like if we put our gloves on and we wring out our rags and then we go to put the soap or anything, is it okay that we're touching that?
Yeah, it's perfectly okay. Yeah. Yeah. You haven't really touched the patient yet. I mean, you might have put their foot in the basin, but you haven't really touched anything significant, right? It's just skin. Perfectly okay. Now, I wouldn't touch that soap with body fluids on my gloves. But for the test, they're not grading it.
So what would you do? You would just take your gloves off, wash your hands, get new gloves before you touch?
Well, you wouldn't have to wash your hands again because it's the same patient, same
Right.
cooties. No, you just change,
new
you could
gloves.
change your gloves. It really depends on what I'm working on, to be honest with you. It really depends on what I'm working on. We're getting way into the weeds as far as the test goes. Test doesn't grade you on any of that. They don't care. They don't care. I always think, so let me explain infection control from my standpoint, okay? I am not really ever focused on this skill when I'm talking about infection control. I'm always thinking about the next skill. And the reason that my mind thinks that way, okay, is if I know that I'm going to use this supply in another skill at some future point in time, does this supply need to be somewhat clean? Does that make sense? So I'm always thinking about that next skill. So if I'm going to use something again later or tomorrow or the next or whenever, if I'm going to use a supply, then the processes I use right now have to be done in a way to keep that supply clean for that next skill. Does that make sense? And if you it's kind of a hard thing to get your head to wrap, but if you can make that jump, if you can always be thinking about supply cleanliness based on the next skill you're going to do, then this skill kind of takes care of itself.
But wouldn't that be like a different patient, maybe a different?
No, I'm talking about same patient because these supplies are only used on this one patient.
Okay.
So let's say that right now this morning I'm doing foot care, but later on today, maybe after lunch, I'm going to do a partial bed bath. So I need all these same supplies. I need the basin, I need the soap, I need the lotion, I need all those things. So how can I do this skill but keep those things clean for that next skill? Yeah, so kind of put the processes in place that you need to do that. But again, we're way in the weeds because the test does not test us on any of that. They don't care. Their thing is the first thing those gloves should touch,
Patient.
and that's what I stress. They don't care about anything that happens after that. Okay, good.
Question 3. Whatever you wash, you rinse. Whatever you rinse,
You dry.
Dry. Yep.
Oh, no, I'm good.
Okay. All right. I'm sorry. All right, so we're going to follow our linen rules. We're going to follow our washing rules. We're going to follow our basin cleaning rules. And I'm not saying these because we already know them. We've been over them before. And we're going to do our foot care steps, which is soak the foot, wash the foot, rinse the foot, dry the foot, look at the foot, apply lotion everywhere but between the toes, put the sock back on and the shoe back on. That's foot care. And then we're going to end it with the closing. And that is how we're going to get all of these things checked off. Now, this looks like a long checklist. I get it. It really does. But when you break it down into its little components here, all of these building blocks, it actually is kind of a roll your eyes, you know, it's easy. I already know. I mean, I know all these. I know all of them. So it's not a hard skill as long as you don't, you know, as long as you young people can get up and down off the floor, it's an easy skill. Good? All right, let's watch the video on this. Remember, this care plan is only for this patient, just this one. That one's going to have a different care plan. She probably gets in the shower. We wash her feet in the shower. I'm not worried about it. That one over there, he's got some real toe issues going on. Podiatrist comes and takes care of him. And that woman back there, yeah, we do both of her feet at the same time. They both fit in the basin. So we put them both in the basin, take them out, wash them, put them in rinse, take them out to dry. We do them all at the same time. This patient, though, she only needs one foot done. Do I care why? No. Care plan says 1 foot. How many am I going to wash?
One.
What if they have 3? Still only doing 1. Now, yes, that's an observation. But, you know, here's the thing that we really have to understand is that all the thinking has been done for us. Everything that we need to do the skill has already been decided. All we have to do is take that recipe and follow it. That's it. That's all we have to do. If we can't follow the recipe, then of course we're going to let somebody know about that. But all the thinking has already been done for us. So if you catch yourself going, nah, I think, you're probably going to make a decision that you don't have the ability to make. Follow the plan. Does that make sense? Yeah, how hard can this test be, guys? All right, let's watch the video. Hello, good afternoon, Mr. Jones. My name is Patty, and I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I'd like to perform foot care on your right foot per the care plan. Is that okay?
Yes.
Let me close your privacy curtain, wash my hands, and get my supplies, and I'll be right back. After washing my hands, we'll gather our supplies. We're going to start with a barrier on the floor under the patient's feet. So we'll spread the barrier out. And can you move your left foot to the side, please? Thank you. I'm just going to place this barrier on the floor. If you can lift your foot. Thank you very much. And we'll move that shoe out of the way. We'll also need a basin, soap, and lotion. Once the barrier is in place, we're going to get 1 towel and 2 washcloths and take them to the patient's area. You can place a barrier on the floor to kneel on, but this is optional. All right, Mr. Jones, I'm going to go get some water in the basin. I'm going to use a paper towel to turn the water on. Check the water temperature with the inside of my wrist. It should feel warm, not hot or cold, just warm. And we'll fill the basin about 1/4 of the way full. And then throw the paper towel away. Mr. Jones, would you like to check the water temperature?
Oh, that's beautiful.
Very good. I'm going to set this down. For this skill, I need 1 set of gloves. I'm going to go ahead and put my gloves on before we get started. And then I can take your sock off. We're just going to lift your foot and remove your sock. We'll set your sock to the side, being careful not to overextend, and place your foot into the basin. After your foot has soaked for a few moments, I'll place the washcloths in the basin and rinse your foot, and then lift the foot out and place it on the towel, wringing out one of the washcloths and applying soap. We'll apply soap to the top leaf and then wash all surfaces with short, soft strokes or a patting motion. We're going to wash down each one of the toes and then get in between the toes. And then gently we'll lift the foot with support and inspect the bottom of the foot while we wash all areas from top to bottom. And then we'll set this washcloth aside and place the foot back in the basin to rinse. We'll use the second washcloth to rinse the foot, squeezing the water to make sure that the foot has been rinsed well. I'm going to unfold the towel and lift the foot and place it on the towel to dry. We'll blot the foot dry around the ankle, the top of the foot, the heel of the foot, and then we'll lift the foot gently to dry the bottom. We'll take an edge of the towel and slide it gently in between each toe to blot to make sure no moisture remains behind. Now that the foot is dry, we'll get some lotion, warm it up in our hands, and then apply it to all areas of the foot except between the toes. So the top of the foot, the heel of the foot, and the sole of the foot, but not between the toes. And then we'll wipe off the excess lotion. The care plan has told us to replace the patient's sock. So once the lotion has been removed, I'll take the sock, make sure it's right side out, and scrunch it all the way up to the toe seam. We'll put the sock over the foot, making sure the toe seam lines up across the toes, and then we'll secure the sock over the heel, minimizing wrinkles and making sure the sock fits appropriately. And then we can gather our dirty linens and place them in the soiled linen hamper. So we'll place our soiled linens in the soiled linen hamper. Now we can clean our basin. I'll bring the basin to the sink. We will dispose of the water in the sink, rinse the basin, and then dispose of the rinse water in the sink as well. I'm going to set the basin down, disinfect it per facility policy, and then use a paper towel to pick it up. We'll dry the inside with a paper towel. Throw that paper towel away. Dry the outside with a paper towel and throw that paper towel away. And then get one more for the drawer. After cleaning the basin, we'll use the paper towel to pick up the soap and the lotion and return the basin to storage. We're going to put our supplies away by opening the drawer with a paper towel. We're going to put the basin, soap, and lotion in the drawer, close the drawer with a paper towel, and then we'll throw the paper towels away. And then we'll remove our gloves, being careful not to contaminate our hands. So now I'm going to gather the barrier, and we'll throw this away, and I'll help you put your shoe back on. There you go. Are you comfortable?
Yes.
Is there anything else I can get for you while I'm here?
No, thank you.
Would you like a magazine before I go?
No, thank you.
Your environment is clean. I'm going to go open the curtain and give you your call light.
Thank you.
Okay, Mr. Jones, here's your call light. If you should need anything at all, just press that red button. I'll be happy to come back and help you.
Thank
Is
you.
there anything else I can get for you before I wash my hands?
No, thank you.
Okay, have a great day. I'm going to go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done. Yeah, we taped that one like 6 times.
Yeah, and then it's so petty, but I would have put a shoe on and then put his foot down and then gone.
Doesn't matter. Doesn't matter.
So for the skills where they're in the chair, would we put them back in the bed before we leave?
No, not unless care plan specifically tells you to. That's a different skill. That's going to be transferring, which we are going to go over next week. Okay. Good. All right, moving on. Mouth care. You guys all know how to brush teeth, don't you? Haven't you done it once or twice?
Today.
I mean, you know how to do this. This is not a hard skill to learn. So if you're looking at page 92, if you look down the side, you can see all the principles. We have some skill-specific steps we're going to go over. At the bottom tells us information about the test. Somebody with your level of experience should be able to brush somebody's teeth in 12 minutes or less. 12 minutes. They give you way too much time to do that. We are not flossing. You don't even have to brush for a specific amount of time. There's no timing to this. As long as you brush all surfaces, they don't care how fast or slow it is. Okay? And they give you 12 minutes. So don't rush through this. You got plenty of time. Well, let's talk about it. Oh, this is live patient skill, by the way. You may be the patient for this.
Oh, yeah.
Someone may brush your teeth during the test. Deal with it. That's all I can tell you. All right, if you look at the top page 93, you'll see the care plan. Supplies are at the bottom of the page, step-by-step directions in the middle. I know I'm going fast, but this is not a hard skill, guys. Here's our care plan. A resident with natural teeth is lying in bed and needs mouth care. The resident is not able to provide their own mouth care. There's your instructions. Brush their teeth. But it says they're lying in bed. Is that a safe position? No. So what do you think we need to do? Sit them up. That is a critical checkpoint. You have to sit them up. I don't care when you do it. But we got to talk about it. Is that bed controller clean?
No.
No, it's really not. But remember our rule, we can't touch the patient until our hands are. Okay? So here's the issue for this particular skill. And there's a couple ways you can get around it. And I'm going to start this off by saying they're not grading you on any of this. They don't care. They don't care. Other than don't touch the patient until your hands are clean. They do care about that. But here's the thing. When you put the head of the bed up, let's go. Okay. When you put the head of the bed up, because we have to for safety, that pillow that's behind their head is going to force their head forward. It is comfortable when you're laying down, but when you're sitting up, it is not. Everybody with me? Got it? That pillow behind the head, not comfortable. So we really need to move it. And the best place to move it is behind their back. Have them sit forward, slide it down. So now they're sitting in a more upright position rather than kind of semi-reclining, right? So we want to slide that pillow down, but we can't until we've washed our hands. So that means if we put the head of the bed up first, that patient's going to be sitting there with the pillow behind their head while we're washing our hands. Uncomfortable. You can do that. Perfectly okay for the test. They don't care. But there's a better way. There's a better way. Don't put the head of the bed up during your opening. Hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you? I'm here to do mouth care. Is that okay? I'm going to close your curtain, go wash my hands. I'm going to get my supplies, put them on my barrier. And then I'm going to put the head of the bed up. We know that bed controller is not clean. I've already washed my hands. We know it's not clean. What could I use between my clean hands and that dirty bed controller? A paper towel. Make sense? So that's kind of how we get around it. That's what you're going to see in the video. Now, it doesn't matter whether you put the head of the bed up before you get your supplies or after. Nobody cares. Nobody cares. But when you put the head of the bed up, slide that pillow down, please. Get them comfortable. Good? Good. Putting the head up is a safety checkpoint. So that's what this is going to tell you. You have to wash your hands before you touch the patient. So the steps are going to tell you to wait until after you've washed your patient, then use a paper towel between you and the bed controller to put them up. Okay? Now, when we're brushing somebody's teeth at a sink, they're leaning over the sink. All that foamy mess is going to go down into the sink and life is great. But if we're brushing your teeth when they're laying in bed, even if we've sat them up, all of that foamy mess is going to end up on their clothing. So what could we put on their clothing to protect them? A barrier or a towel. Yeah, a towel's probably a little more natural. It's what we're used to using for mouth care. You know, it's, you know, kind of normal. So put a towel over their chest. That is an important checkpoint. We're going to wet the toothbrush before we put paste on it. This is just like hands. Remember how we had to wet our hands before we put soap on with hand washing? We're going to wet the toothbrush before we put toothpaste on it. We're going to wet the washcloth before we put soap on it. Right? We always wet something before we apply something else. Make sense? Okay. Now, I've got this toothbrush and I got some toothpaste on it and I have to put my gloves on. So I'm like, I don't have enough hands. So I'm going to set this toothbrush down in that emesis basin just for a second so I can get some gloves on. That's where it's going to stay, right? It's just going to hold that toothbrush. Then I'm going to get my gloves on and then I'm going to brush. That's it. I mean, this is your checkpoint. You see what it says? Brush sides and biting surfaces of teeth and gum line with a gentle motion. Does it tell you how long? No. It just says brush. So what are you going to do? Brush. Brush the top, brush the bottom, brush the front, brush the back. Just brush. Got it? So they're giving you way more time to do this than you need. 12 minutes, way longer than you need. All right. So only use a little bit of toothpaste. Pea-size amount is all you really need. The more toothpaste you use, the more they have to rinse and spit. Okay, a little bit of toothpaste is all you need here. And then let them rinse and spit as much as they need to. This is the number one step that's missed on the skill. People forget to dry the patient's mouth after. I don't know why. I'm not sure where your brain goes. I have no idea. But people, CNAs, students being tested, will walk away from the patient with a whole bunch of foam and saliva on their mouths and never even realize, they don't look at the patient. They don't realize that that's a problem. So the patient ends up doing this. So don't do that. Make sure you're paying attention here. Dry their mouth. Now that I brought it to your attention, you're going to pay attention. But it'll be funny because chances are one of you is going to end up having to wipe your mouth off with your shirt during the test. And you'll think of me when you do it. You'll think of me. All right. Common question, am I going to have to brush everybody's teeth? The answer is no. If somebody can brush their own teeth, we're going to let them. That's independence. But this is a weird skill to have done on you. It's just weird. It's awkward. if somebody can brush their teeth, they're going to. Now, we may have to squeeze the toothpaste for them if they don't have any good hand strength or have limitations, mobility. You know, we may have to help them with certain parts of this, but we're going to let them do what they can do on their own. So no, you're not going to brush everybody's teeth. Now, the next question I'm going to get is, what about dentures? And we're going to cover that on Monday. Stay tuned. All right, so now we know all of our steps. We're going to put them together to check off our checklist. We're going to follow that care plan. We're going to do our opening. We're going to get some gloves. You do need gloves. This is body fluids. You will need gloves for this. You're going to use a barrier on your table and get the rest of your supplies. Pay attention to your linen rules. Don't hold anything against your uniform. Nothing goes on the floor. Nothing goes on the floor but shoes. I'm going to change that. All right. We're going to clean our basin the same way we clean everything else. And we're going to do our steps for mouth care, which is wet the toothbrush and brush. Those are your steps. Wet the toothbrush first, put some toothpaste on it, and brush. Those are your steps. Make sure you dry the face afterwards, and then you're going to do your closing. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Environment's clean, bed's in the low position, open the curtain, here's your call light. I'm going to go wash my hands. Done.
Would you keep that toothbrush for the residents? As long as they're-
Oh, good question. Good question. All right. And the answer to that is it depends. If we are in a hospital setting and they're brushing their teeth on their way to go home, right? They're being discharged today. I'm going to throw that toothbrush away. If they're in a long-term care setting and this is where they live, you don't throw your toothbrush away every day. So we rinse it and we put it back where it goes. So the answer to that is it depends. Now for the test, you are only there for 3 skills. You're the patient for 3 skills and you're going home after that. She's going to be the patient for the next 3 and then you're going to be a patient. We don't want to put that saliva covered toothbrush in this drawer when you are a patient and you are a patient and you are good.
Yeah.
Good. So for the test, we're going to throw the toothbrush away because our patient isn't going to need it again. But in a clinical setting, don't throw your patient's toothbrush away every day because they charge like $17 a toothbrush. Oh, I have a question. Okay. Zia, is it Zia? Yeah, Zia says, what is indirect care? What does indirect care mean? Indirect care is a lot of what we call intangibles. It's going to cover infection control. It's going to cover how you treat the patient. It's going to cover all the nice stuff. Indirect care is basically everything I tell you to do. Most of what I say falls under indirect care. Okay, unless it's like part of the actual skill, like toothpaste on toothbrush, that's a skill step. But talking to the patient, that's indirect care. Infection control is indirect care too. All right, this care plan is only for this patient. That's it. Nobody else. All these other people are going to have different care plans. We're just going to follow their care plan for them. Let's watch the video. We're getting there, guys. We're getting there. See, if I could just do this every skill, we'd get done a lot quicker. I know. I talk too much. I know. It's a problem.
Hello.
Good morning, Mr. Jones. How are you?
I'm well. How are you?
Fantastic. I'd like to perform mouth care on you. Is that okay?
Yes.
I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. I'm going to use a paper towel as a barrier to put the head of the bed up, since my hands are clean and the bed controller is not. Once we get the patient to an upright sitting position, I can throw the barrier away and then adjust the pillow so it's a little more behind his back rather than his head. There we go. Good?
Yes.
Okay, let me go get the rest of my supplies and I'll be right back. I'll gather my supplies. We're going to start with a barrier, and that gives us a clean place to place our clean supplies. So we're going to open the barrier up. And I also need a towel. We're going to get an emesis basin, a toothbrush, toothpaste, and a cup of water. And we also need a pair of gloves. I'm going to get my toothbrush prepared by wetting it and putting toothpaste on, and then storing it in the emesis basin until I'm ready to use it. Mr. Jones, can I place this towel over your chest?
Yes, please.
Thank you. This is just going to help keep your clothing clean. I'll put my gloves on. And now we're ready to brush your teeth. I'm going to brush the top, the bottom, the front, the back, and your tongue. So can you open wide for me? I'll start in the back, on the top, both sides. And then the bottom, both sides. The front, both top and bottom. And can you bring your teeth together? Thank you very much. And then stick your tongue out. Thank you. I'll set this aside, and now we can rinse. Go ahead and take a sip. Another sip?
Yes, please.
Okay. I'll pour the water in the emesis basin, set them on the table, and then I'll take this towel away and put it in dirty linen. I'm going to go clean my basin. We'll clean the emesis basin by dumping the saliva into the sink, rinsing the basin, setting it down, and disinfecting per facility policy. Then we'll take a paper towel to pick it up, a paper towel to dry the inside. We'll throw that paper towel away. Paper towel to dry the outside, throw that paper towel away, and one for the drawer. Now I can return the basin to storage, putting the toothpaste in the basin and using a paper towel to open the drawer to store the basin back in it. We'll close the drawer with a paper towel and then throw those paper towels away. All of these disposables will be disposed of. I'm going to go throw this away. I'll be right back.
Okay.
Now I can remove my gloves. Okay, Mr. Jones, is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Okay. Bed is in the low position. Your environment is clean. Let me get your call light for you. Would you like a magazine before I go?
No, thank you.
Okay. Here's your call light. If you need anything at all, just press that red button. We'll be happy to come in and help. I'm going to go open your curtain and wash my hands. After washing my hands, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done.
Your student?
No, he's my son. That's my oldest. That's my mini me, actually. That's my oldest. All right. Got a side ponytail going on here. Okay. We are running late as usual. We are going to move respirations to a future class. I will get to it. I absolutely promise. You got to trust me. I've never let a class go without knowing all of the skills. Okay. So I would never, ever, ever, ever do that to you. But we are going to have to push it off till later because we have to go over test registration. All right. So, all right. So this is a packet. Jake, do I have one? Please. Pretty please. Thank you. All right. This is the registration packet. It is big. We have a lot to go over. It's not as complex as it looks. Okay. But this is your cheat sheet. Okay. This is your cheat sheet. We're going to refer to both of these as we go through this. But before we do that, I want to bring to your attention where you can find resources on this. If you go to my website, 4YourCNA.com, the top menu. Now, I am going to be changing this in the next probably 2 months. So this will work for you guys. But in about 2 months, I'm changing my website. I'm simplifying everything because people can't really find what they're looking for on there. So the way, and I thought it was pretty intuitive, but I've got CNA training. That's all videos, training, practice tests, that type of thing. I got CNA testing. That's all testing stuff like test registration, which is what we're doing here. And then I've got after certification. That's where you're going to find your jobs and your continuing education stuff. I thought it was pretty easy, but I'm getting a lot of feedback that people aren't, it's too complex. So I'm going to simplify it for them. So right now for you guys, if you want more information about what we're going to go over, go to my website and go under testing because this is test related. When you open up that testing menu and you scroll down, you can see test registration instructions. I have already done all of this for you. There's a video on there where I do an online registration right on the screen. You can see what I put where and I tell you why, just like I do with everything else. But that video goes a little bit fast because I'm doing it. So below the video is a step-by-step slide presentation with screenshots of everything. So the video gives you a good overview. The step-by-step is a follow-along that you control the timing on. Okay, so both of those resources are available for you. Now we're going to fill out the paper application together in class right now. You can mail in this paper application if you want to, but it takes longer to process if you do that. If you take this, the online application is this. It looks exactly like this, just on the screen. If you take this and use it as a template and just transfer the information, you'll know what to put where. There are 3 differences between the paper application and the online application. We're going to go through those as we go. Good? Do you guys know how to find resources? Okay, so this is our sheet. This is the 4 steps of the testing process. Step 1 is obtain a background check. That's step 1. If you turn it over, it tells you how to obtain a background check.
I'm sorry, 'cause I see here, submit a new one. So if we have our little background check, we still have to do this?
Yes.
Because I get this question every class. All right, so I went on to the Board of Nursing, onto their FAQs for CNA. Okay, so I did all this research for you. So the Florida Board of Nursing frequently asked questions. This is one of the questions. If a background check is completed at the time of a training program or employment in this case, right? Must it be completed again at the time of application for CNA exam? And according to the Board of Nursing, it says yes, a new background check is required on all new applications for the CNA exam. This is not from me. This is directly from the Board of Nursing. Okay. So I have had students that currently work in healthcare that did not go get a background check, and their current one was found and they were cleared for testing. So I have had some people who did not follow the process and were still okay. All I can tell you is what the Board of Nursing tells me. Okay? Is that clear? I would recommend everybody get a new background check. They're only good for 5 years. I just had to redo mine last year. They're only good for 5 years, so you'll have to do that periodically.
I took mine for my child special needs certification.
Okay.
Teaching, at least.
So here's the deal. Let me explain to you how this works. I've got a slide for this too somewhere. Let me explain to you how this works. Okay. When you get a background check done in Florida, it does not go to a big bucket. When you get a background check in Florida, you have to use a code that tells the background check people what it's for, and they send it to just that filing cabinet only. So if you had a concealed carry is the only people that can access that background check. If you worked for a bank, financial is the only people that can access that background check. I have no idea. I don't know what filing cabinet it went into. And this is part of the problem why the Board of Nursing says everybody has to have a new one. Okay? Because it's all about that code. That code is kind of like the key that unlocks the ORI number. Yes.
I'm 18. This is like really new to me. I've never done this before. So I thought like your job does a background check. So you have to create your
Yeah, and
own.
normally you have to pay
Right.
for your fingerprint.
Okay.
Get approved for any state.
For a
exam
test.
that you
Yes.
take.
I'm 19. I was in the exact same boat you were in last year
Okay.
when I got my child certification.
Yeah, you are responsible for paying for your own background check in most situations. So for licensing, for employment, you're responsible for covering that background check cost. Now, the good news is that it's kind of industry based. So if you're registering for the test, you get your background check done and you use that ORI number, tells them what filing cabinet to send your results to. Medical employers can access that. So it used to be a couple years ago that you had to get a new background check for testing for every employment. So if you went to work at a hospital, you had to get another. If you left that job, went to work in a nursing home, you had to get another one. So every time you changed jobs, you had to get a new background check. So thankfully, they stopped that, right? So anything in medical can access it for 5 years. So they did make it a little bit easier for us. So one and done. But yeah, you are responsible for that. We're going to talk about, hold on one second. I'm going to talk about the background check. Okay, so let's get into the specifics of the background check, because I always get way more questions about the background check than I do the test registration, which is crazy to me. Okay, so these are our steps. You can get a background check done pretty much anywhere. Okay, I'm not going to tell you that you have to go through these people, but my students have the best success and it's processed the quickest going through ORI. I get no kickbacks from them. I'm not an affiliate, nothing like that. It's just experience. A little over a year ago, my entire class went to the sheriff's department. Sheriff's department said, yes, we do them for employment, for licensing, no problem. They went to the sheriff's department and it took every one of them 6 months to test. I called the sheriff's department. Do you do that? Yes, we do them. For the yes, we do. Swore, but it took forever for my students to test. Now, I don't know if there was a glitch. I don't know what happened. I don't know. But I do know that every student that does this gets tested like that. So that's all I'm passing on to you. Okay, there are a million other providers. You can go onto Florida's Live Scan website, find a pick one. I don't care. I don't get any kickbacks from any of them. This is just the one that I know works. It works well and it's quick.
I do have a kind of important question, at least for my situation. When you do get a background check for your, whether it's for the facility or for your testing, do you have to get a drug screening? If you do get a drug screening, will a medical marijuana card comply with that?
Okay, so drug screening is completely separate from background check. They are not tied in any way whatsoever. So what you're talking about is employment requirements. There is no drug screen for the test. So what you're talking about specifically is for employment. And to answer your question about medical marijuana, I have no idea. You'd have to ask the employer about that.
Okay,
So that would be a great question for your interview.
that's what I use for my seizures. I don't use that. I mean, I use Keppra outside of that.
Yeah. So, and you'd want to let them know about the seizure disorder and, that this is the medication that you use for it. Just let them know. There's people that are on, painkillers and things like that. And you just have to kind of provide proof that, it is medically supervised or whatever. But that's a great interview question. Okay. So if you go to DTIS, this is who I recommend. They use the UPS store at Barclay and Spring Hill Drive. That's the UPS store they use. You can go anywhere, but you have to, well, let me back up. You can walk in and get it done, but they're going to charge you like $20 more. If you register online, a lot of times you can get same day appointments and it's $20 less. So for me, I'm registering online, but registering online is a little bit complex. So I got to walk you through it real quick. Okay. This is the system. This is the way it works. You have to get the background check first. If you register for the test first, what happens is the test, or Prometric goes to that filing cabinet and they try to pull your background. And if it's not there, your whole application stops and it can take a while to restart. It's not like automatic. Okay. So you've got to have the background check in the filing cabinet. So when you register, Prometric goes to the filing cabinet, picks up your background check, bundles it together, and sends it off to the Board of Nursing for approval. Got it? So that's why background check is always first. Super important. This is the whole process. It's a little bit complex. You get your background check, you apply with Prometric. Prometric then goes and grabs your background check and your payment, puts it in a packet, sends it to the Board of Nursing. And the Board of Nursing, this is a human event, by the way, it's not automated. A real person is sitting at a desk going through all of this paperwork in real time. They look at your application, they look at your background check, they make sure the payment went through, and then they clear you for testing. So the next question you guys are all going to have is, what if I have a criminal background? Because that's what they're looking for. Everybody was young and dumb. Everybody, not everybody got caught. They understand that. Okay. They look at every situation individually. They look at the seriousness of the offense, how long ago it was. Did you make restitution and complete all of the court required situations? How many you have? So let me put this in perspective. If you've got one shoplifting charge from 7 years ago and you took care of it and you've been on the up and up since, they can understand that. They will probably approve you for testing. I don't make the decisions. I can't tell you yes or no. I'm just saying chances are. If you've got 14 shoplifting charges and the last one was 3 weeks ago, they will probably not approve you for testing because that shows a pattern. Here's the deal. I have been preaching this for 2 weeks now. The test is all about the patient, right? Well, so is the Board of Nursing. Their responsibility is to keep the patient safe from you. So as a CNA, you are allowed to go into patients' homes and care for them in their homes. Well, if you've got sticky fingers, we don't want you in grandma's home around her silver candlesticks and her credit cards and her medications, because it's showing that you kind of have a problem in that area. Make sense? So they look at everybody's background check individually. Now, if you have something that makes them go, I'm not sure, they don't automatically stamp it denied and send you on your way. They're going to contact you and they're going to say, listen, we see something on here. We want a little more information. Could you please write out your side of the story and send us the court documents? So if you don't have the court documents and you have a background issue, get your court documents together while you're waiting, because you'll probably need them. You send that in. They're going to look at it and they may approve you. Okay, your side of the story has been presented. I can kind of get behind it. I understand you had a bad breakup. You were charged with domestic violence, that type of thing. We get it. But if it was assault with a deadly weapon because of a bad breakup, been there, done that, I know. Okay. They're probably going to want a little more information than just a single sheet of paper that you typed out my side of the story. And they're going to ask you to come to a board of nursing meeting so they can meet you and get to know what happened. Why do you think we should take a chance on you? How can you assure that grandma's going to be kept safe if we let you become a CNA? And they're going to really kind of gauge where you're at. That's when they make the decision to approve or deny. It's not an immediate no from the get-go. Does that make sense? They give you a ton of chances all the way across the board.
If there are charges that have been sealed or expunged,
We're going to talk about that in a little bit. You have to declare them. You still have to declare them, because it has to do with good moral character, and they're going to find them. Lawyers lie to you all the time. Lawyers will swear, give me $5,000, I'll make them disappear. They'll go to the bottom of the ocean. Nobody will know that they're there. They lied, because we do find them. All right, Miss Patty, I'm coming to let you know that I passed my CNA test on Wednesday. It's all about your videos game show. Thank you for the great work. Thank you so much. Oh, I'm so proud of you. Welcome to healthcare. And thanks for tuning into the game show. Next Tuesday will be our next one.
I was thinking yesterday was the first.
Yeah.
And I was thinking, I want to do the game show and all day long.
Yeah, today is, I know I got an extra week off between game shows, which is good because I'm working on this. And I think I'm going to hopefully, keep my fingers crossed, I think I'm going to debut this concept in the next game show. All right. So do you guys understand the process here? Okay, it's not an automatic no. So go get your background check. This tells you how to do it. Follow these instructions. The background check will include a picture. So it's a picture, fingerprints, and signature. All right. So once we've done the background check, then we can do the test registration. Prometric's website. Okay, so this is Prometric's website. Prometric's website is where we would, I've got to put that on here too. Jake, can you make a note? Add Prometric's website to the testing flyer, please, for the next run. Okay, so Prometric's website, take a screenshot or whatever. Prometric's website has all of these accordions. We want to go to application process to find the online application. It's also where you can print out another copy of the paper application that you guys have. Okay, but this is where you're going to find the online application. Online, paper, exact same, except for 3 small details we'll go over. This is what the application looks like, and this is what you have in front of you, this. Now, I'm going to go through this super fast, but you don't need me for 90% of it, okay? So I'm just going to outline the stuff you can fill out at home. We don't have, you're not going to sit here and write your name on there. You can do that at home. But one of the first things that we have to talk about is the stop sign. Please make sure that the name you put on this registration is the name that is on your photo ID, and you have a secondary ID that can back it up. So a debit card, a credit card, a social security card, something with a signature that matches. Like my name is Patricia, but everybody calls me Patty, Miss Patty. That's how I'm known. So I'm not going to put Miss Patty on here. Good? Make sense? All right. So, and the fact that they have to put this in great big letters right in the front tells you how many problems they have with this. All right. So you're going to indicate if you need ADA accommodations, seeing eye dog, sign language interpreter, that type of thing to test. It should not apply to any of you. But it's there if you need it. Oh no. Oh no.
I got it. I think I got it.
Okay, good. All right. So at the bottom of that page is your demographic information. Fill that out on your own. We're not going to do that together in class. Goes to the top of the next page. Fill that out on your own. Let's go to the bottom section of page 2. This will mess you up. There's a lot of words here. Let me break this down for you quickly. Good. If you have a felony in your background, a felony, you need to see me after class. If you have no felonies in your background, for number 1, check no. Leave A, B, C, D, and E blank. Don't put anything in there. If you have no felonies, check no for number 2. Questions 3, 4, and 5 are about this specific situation. I'm going to give you a situation. If it applies to you, see me after class. If it does not apply to you, you're going to check no. Got it? The situation is if you worked for or you were a healthcare provider that got caught committing Medicaid or Medicare fraud, and you were prosecuted and you were told that you cannot ever work in healthcare, and your name went on a list of people who can never work in healthcare, then 3, 4, and 5 apply to you. If that scenario does not apply to you, check no for 3, 4, and 5. This is why you need me to help you fill this out. No, not doing any A's, B's, or C's. Good. I know that's a little bit complex. You can go through and read it on your own, but that's what those questions are referring to. It's asking if you've ever been sanctioned for Medicaid and Medicare fraud. They're not talking about as a user. They're talking about as a provider. Okay. Now below that is disciplinary action. If you've ever had a medical certification in Florida or any other state and you had discipline taken against you, answer those questions. If not, they're all no. If you've never had a medical certification, they're all no. Now below that is criminal history. The first question is asking, do you have one? There's only 2 choices, yes and no. Do you have a criminal history? DUI does count as criminal. Traffic tickets do not. Check yes or no. The next question is, have you ever had any records sealed or expunged? In that case, you would check yes or no. The last question is juvie records. Do you have a juvie record? If you do, check yes for the third question. They look at it all individually, okay? So if you've,
My juvenile records are sealed and I have one adult expunged.
Yeah. They'll ask you for information. Yeah. They're going to ask you for your side, okay? All right. Oh, I did not keep up. All right, so the next page, page 4, we're going to skip. You have to read those and answer them yourselves. I cannot help you. And the next section is your social security number. Can't help you there either. Go to page 5. This is where it gets a little complex. If you notice, I've already filled out most of page 5 for you. Everybody has to register as E3 Challenger. If you register as anything else, it will prevent you from testing. So this is critical, guys. If you do the online application, make sure that you're checking E3 Challenger, not anything else. I know you're sitting in a classroom. This is not a 120-hour program of clinicals. We don't qualify for that. You are going to test as a challenger, like 80-something% of all people in Florida that test. It's the number one way that Florida tests. Now, below that, I crossed out, I put an X through training information. We only fill that out if we checked E1 or E2. What do we check? E3, doesn't apply to us. Move down to the next section. Test location. All of you are testing at a regional test site, but you get to choose which regional test site you are going to test at. So in the very back of the packet, the last 2 pages of this packet are the test sites for Florida. Now, I've divided them up into regions. So like North Florida, Central Florida, South Florida. If it's highlighted, it means it's one that we recommend in our area. They're the closest ones to us. I think I've highlighted 4. 1 in Ocala for my Citrus County people, and 3 in Tampa. Okay, the best one for us, if you live in Spring Hill, is Agillis. Agilillas. It's it's the second one from the bottom.
That would probably be recommended too for Newport Richie.
Yeah, so if you're going down the Parkway, the reason we recommend it, if you're going down the Parkway, it's north of the airport, just off the Parkway. The other 2 Tampa ones, one is way over by Busch Gardens. The other is way over by 275. Right. So right next to it, you see that test code. Okay. Do you guys remember I said that there are 3 differences between online and paper, right? So paper, you have to write in that test code, TAMAIR. But online, it's a drop-down menu. You're just going to select the one that you want. Well, but there's no addresses. It just says Agillis, Tampa, and you don't know where that's at. So that's why I give you the printout. Good. So difference between online and paper. Online, you write the code. I'm sorry, paper, you write the code. Online, drop-down menu. Questions so far? All right, let's move on.
Page 5 under test site information.
Go to the last 2 pages.
No, I found which one I wanted to go to.
Okay.
Where are we putting?
Halfway, right here on the board. The arrow is pointing to it. You're good. All right, now down below that, these are all the test site locations. Down below that, oh, there you go. I just had to advance the slide. I keep forgetting that. Okay, down below is what test do you want to take? So most of you guys are first-time testers. You're probably going to choose one of the first 2 options. One is the plain Jane test. The first one is the test 99% of people take. But some of you may have a language deficit or a reading comprehension problem, and you want the computer to read the questions and answers to you. If you want the computer to read to you, check the second option. If that doesn't matter to you, check the first option. It's the same cost. It just asks, do you want audio or not? Now, if you want the written test in Spanish, that's another option about halfway down. So if you want the written test in Spanish, you can choose that. The rest of them don't apply to us because those are for retesting. Retesting. Okay, we're not retesting, we're testing first time. So those don't. Now, online, it's going to ask you first time tester or retester. When you click first time tester, all those other things go away. And it's just going to give you those three options: regular, with audio, or written in Spanish. Good? All right. Fee is $155. If you're doing paper application, you're going to there's a page in here for your payment information. You're going to fill it out or get a money order. No personal checks. Online, the only way you can pay is by debit or credit card. And there's going to be a payment information there. We're going to talk about that in a minute. I know I'm keeping you late. Bear with me. If we go to page 6, at the top, there's a box that says yes or no. It's asking, did you receive the FBI and FDLE privacy notices? They are attached to your packet. This is how they're going to use your information to clear you for testing. They are in your packet, so check yes here because you did. Then you're going to read the affidavit, sign and date. You can do that on your own. Let me go to the bottom here. I'm trying to hurry, guys. The bottom, it says, if you do not receive your authorization to test in 10 to 14 business days, contact Prometric. 10 to 14 business days, that's roughly 3 weeks. So when you send your application in, you should have your test date within 3 weeks. If you do not have your test date within 3 weeks, who do you call? Do not call me. I cannot help you. I'm sorry, did you catch that? I roll. All right, you're going to contact Prometric, not me. I can't help you. But when you call, it's helpful to ask for a supervisor because the person that answers the phone doesn't always know and they'll give you some nonsense answer. Okay, so be careful there. All right, sign a date, that's fine. We just went over that. This is Prometric's contact information on their website. Now, real quick, here's the differences. Drop-down menu for testing site we talked about. Debit and credit card. There is a very small box, You have to check I accept for this payment to process. If you miss, and everybody misses this, if you miss that I accept, your application does not process. Okay? Now, one more problem with the online. At the bottom, you've got supporting documents. You have to check one of these. All this is asking is if we want more information from you, how are you sending it? By email or by mail or by fax? I don't care. Just check one. Doesn't matter which one you check. Just check something there. And then you've got 3 buttons. If you click save, it saves everything but your payment information. So if you click save, you got to go back up and fill all that payment information out. Click submit. It will automatically save. Okay? Good? Good. All right. So after you submit your application, you're going to get an authorization to test letter, and that will give you your test date and location. Good? Test date will be about a week later. So if you register this weekend, which is why we do this now, if you register this weekend, you will be testing a week or 2 after graduation. Perfect timing. Jake, review sheet real quick. 2 chapters over the weekend, chapters 5 and 6. 5's on dementia, pay attention, important. 6 is skills. We go over them in class, read the paragraphs in between. Take the test on page 185 and 6. And here's your review sheet that Jake is passing out to you. Thank you so much for hanging in there. You did a great job today. I will see you guys on Monday. Have some fun this weekend. Yeah, it's not all about work. Okay?
Thank you.
Thank you.
Fingerprinting and background check we could set up for
Yeah, you should. Yeah, do it today. Do it today. Yep.
Sooner rather than later is better.
It's in person, right? So fingerprinting is the background check. It's but they don't give you anything. You just go and then they send it to the filing cabinet. So you're not waiting on anything.
The last CNA jab I had was like 10, 11 years ago, and the mess up I made was I used the wrong size sling for the machine. I didn't get fired. I just got talked to, so I don't know if that's considered.
This would be
disciplinary
no,
action.
this would be disciplinary
So you
from the
register
state.
online or with that
Okay, so I didn't
packet
get
stating them
No,
itself, you'll have
no.
I
go
just
to
want to
the
make
physical
sure for
location.
they find.
Oh yeah, yeah. No. It would
And
have
that's
to
the portion
be
you would
It's
either
the only
schedule
thing
with them
I've
or do
done
the
between
walk-in,
two
and
through a
that's
board of
fine.
nursing or something like that.
Thank you.
You're welcome.
Believe so, Ms. Patty. Would you
I'm
apply
sorry?
for the test or do the fingerprinting first?
Fingerprints always first.
There we go.
So
That way, once they do your
register-
application, they can pull it from the system. That makes
So
sense.
set the appointment for the
Too much
background
together,
check
I'm out.
today, and then do the basically the test.
The
sign up for
registration
test. Yeah, the
within
registration for the
24
test.
hours
With from today or like this weekend?
from the background check.
Okay.
So go, and you can actually do it right away, but give it 24 hours to
After
to
the
get there. So do the application for, the registration for the background check, go to the appointment. They don't give you anything. You don't have to worry about that. Just go to that appointment, smile at the camera, whatever, do your fingerprints. And then 24 hours later, do your test registration.
Okay. All right. Thank you.
You're
so much.
welcome.
See you next week.
Bye-bye.
Am I supposed to get an email every after class? Or-
Yes.
Because I haven't gotten any.
Oh, Jake.
You haven't gotten any of your emails
Like
yet?
only the first class, not the
Okay.
other one.
Let me verify.
Jake will take care of you. Those of you who joined us live, I know that I saw some on. Thank you so much for hanging out with us today. I truly appreciate it. And you guys are the best part of 4YourCNA. So those of you who are getting ready to test, lots of luck to you. And we're here to help. Stay tuned for information on the new guided practice test. Super excited about what we're putting together for you to make testing easier. And we will see you on Monday for class 5 and Tuesday for the next game show. Until next time, happy caregiving. Bye.